March 12th special meeting of the Union County Board of Commissioners to order, and I'll recognize our county manager, Brian Matthews.
Thank you very much, Mr. Chair. First off, thank you very much for everyone taking time out of your day to come and spend some time talking about our upcoming budget. Just a couple of announcements. There are some storms threatening in the area sometime between 9 and 11. I'm not sure when it'll actually come by here. If we lose power, we'll pivot and do whatever we need to do, but hopefully it will not interrupt what we're trying to accomplish here today. Our goal is to try and get you out on time, about 2 o'clock. If you do need a break, please let us know. We have some scheduled in here, but if you need one, just let us know if you need a break. And I'm going to go ahead and turn it over to the first presenter, and I believe that is Jason. Let Jason get started on it.
Let's see if I can mess this up. Can you hear me? I'm going to do Richard Pryor style then. Is it on? Good. Good morning. My name is Jason May. I'm the Director of Budget and Grants Management. Appreciate the time this morning. I want to start off by saying thank you for bringing me to Union County. My last municipality in Southwest Virginia got 6 inches of snow last night, so I am much happier to be in North Carolina again than I was in Virginia. I want to start off by going through a mid-year budget update for us. I'm going to talk a little bit about ad valorem taxes here. So as you can see, over the past about 5 years, we've averaged bringing in a little bit over what we have budgeted. That's been due to our conservative nature of budgeting on ad valorem taxes. The other piece that I want to mention in this is that over the past 5 years, you've had a pretty sharp increase in motor vehicle prices. And so that has risen and starting to come back down to reality at this point in time. That was one of the major themes that happened during COVID. And so as we look at some of the past years, I think we're going to be back more closer to at budget going into the future years. So I just wanted to make that note. But for this year, we're not in any concern as far as our ad valorem is concerned, and we're very confident in meeting our budget number. Looking at sales tax, before anybody has a panic, this is 4 months. Again, I would remind you that sales tax comes in arrears. This is a tax that's collected locally, sent to the state, and then redistributed back to us. That's a process that takes time. Right now, we're projecting to be about 2.1% over budget in FY26. Those are based on our current numbers. So this is 4 months worth of collection. If you add that, if you triple that to be able to do the projection, you come in at a little bit over 53 million. So again, we're not in any concern about our sales tax collections at this point in time. We turn our attention to federal and state revenues. I would make a mention in this situation that oftentimes these are reimbursable programs, so we have to go and spend the money, then ask for the reimbursement. So again, there's an arrears or a lag in being able to see this funding come into our coffers. But again, at this point in time, we don't have much concern about this. You can see we've been a little bit under, a little bit over. A lot of this depends upon grants and how we work with our friends in DSS and in public health as well. So there's a bit of an impact in that as well. Overarchingly, we're looking at the general fund through the mid-year. Revenues are on pace to be at or exceed budget in the major revenue areas. Again, our 3 major revenue areas. Our federal and state are lagging just a little bit, but we have no concerns at this point in time. I'll try to read from my screen as opposed to try to see the glare off the TV there. So our expenses are on budget or slightly below. Again, personnel is trending a little bit below where our budget numbers are. Operational expenses are also trending below where budget. The third phase of our compensation study has been completed. The mid-year adjustment for the COLA adjustment has been completed, and then our Union County Sheriff's Office pay plan increase has been completed. So all of the planned increases, both on personnel and in operating, have been completed at this point in time. And when we look out to be able to complete this year, really no concerns at this point in time, either on the revenue side or on the expenditure side. We feel like we have a fairly good runway to be able to finish out the year. Now, with that being said, there's a number of uncertainty that has been in the economy at the moment. And so we're going to continue to watch this through the remainder of the fiscal year, make sure that we don't see anything changing, because again, we're in the middle of a armed conflict at the moment. There's some tariff discussions as far as rebates are concerned. The inflation came in yesterday at 2.4%, so it seems like that's moderating a little bit. We're also watching what the Fed does going into the May when the Fed chair changes. So there's an awful lot of uncertainty and just things that we're not prepared to be able to make really good projections off of at this point in time. But we want to watch through the remainder of the year. So we are watching this, and we want to make sure that we finish the year strong and set ourselves up going into next year. Any questions on the end of the fiscal year for this year? Yes, ma'am.
I do, real quick. What, top of the trees, what was the third phase of compensation study? What did that phase include?
Ma'am, that was the last phase of going to market value. I believe that I'm not as familiar with the rationale for where that third phase was. I came in right at the end of that. I would push to maybe some members of management to be able to speak to that.
Yeah, we did a market rate study, I think about 3 years now, and it was just too expensive to afford all in one swoop. So we did it over 3 phases. I think there was 2 in 1 year, and then the last one was last year. It looked a little bit different for all departments. The sheriff's office specifically wanted to do something a little bit different, but it was just to get employee compensation across the county up to that market level.
So we basically broke it into 3 phases because we just couldn't pay for it all in 1 year.
Sure, okay. So the third phase, did that include certain departments?
It was all departments.
All departments,
Yeah, so
okay, that,
essentially, we didn't break it out and just do one department. We did do the sheriff's office differently, but they were still included in the third phase.
okay, perfect, thank you.
No, more than happy. Any other questions? Yes, sir.
Mr. May, just a question regarding the Union County Sheriff's Office pay adjustments. So we started down this road, I think, out of concern for retention of good officers there. And I was just curious, and maybe this should be directed to county management as well, but I was curious as to what kind of feedback we've received from the Sheriff's Office, if they're reporting that this has been helpful as far as retention purposes are concerned. Any feedback either way?
Sure. So the sheriff's office has been very grateful and appreciative. It has made a difference as far as recruitment goes, and certainly some retention. What we have noted is that some of our more tenured positions, we may need to look at something a little different for them in this next fiscal year. We're having those discussions with the sheriff's office, some things that that other jurisdictions do that we don't do. And so we will bring that to you as part of the budget discussion. But right now it's been positive, and I believe the employees are all very appreciative of that. But that's what we know right now.
Okay. Thank you.
Any other questions before we move into the FY27 preview? Nope. Thank you. So let's turn to FY27. So my team has been working for about the past 6 months and being pulled together some information to get us started on the FY27 budget process. This morning I want to talk a little bit about the organic ad valorem increases, the general fund sales tax projections, a little bit about HR1 impacts to Medicaid and food and nutritional substances, the education and the other funds, and then at the end we'll talk a little bit about a healthcare fund. So with that, I want to turn to the ad valorem. So the 26 budget was formulated with a penny value of a little over 6.1 million. You can see that number there. So right now we are projecting a 3.75% growth factor. That is a little bit of an increase over what the budgeted number was because of the process in our assessment process. So right now we're projecting for 27, our projected penny is just over 6.5 million. Sales tax, and I want you to walk with me a little bit on this because this is a little bit complicated, so I want to make sure I'm trying to explain this carefully for you. So sales tax in Union County is distributed based upon ad valorem values. So the 26 budget was developed using a 4% growth rate. You can see that provided a little over $2 million in new revenue for 26. The actuals at this point in time, as I mentioned earlier, are pacing a little bit ahead of that. We're looking at 6.1%, again, about a 2.1% growth over what our budgeted number was. However, in FY27 will be the first year that sales tax distributions will be based upon the new revaluation for ad valorem. Union County distributes it based upon ad valorem between the towns and the counties. And several U.S. Union County towns did not stay at revenue neutral in their tax rates and increased their share of the ad valorem in the county. Therefore, the county will likely will not realize this extra growth at 2.1% because that correlates to what we feel like we will lose to the towns. So when we go into 27, what we are looking at trying to do is that you can see the 26 number there and then what our 26 projection is and then what our projection for 27 is. And what we're looking at is having a 4% growth rate over top of what we feel like we're going to lose to the towns. So in essence, we're going to grow by about 2.1 million, but we're going to lose some of our organic growth to the towns because they did not remain revenue neutral. Went over that, that means that they're going to get a larger share of the sales tax distribution next year based upon them going up on their ad valorem tax rate. Questions around that, because I know that that can be a little bit complicated. I want to make sure that I'm being clear in that moment.
I do want to point out that there are two ways to do this in North Carolina.
Yes.
There's ad valorem and there's per capita. The towns often want us to do per capita. That is actually worse for the county. We will actually have less money, less sales tax money if we did per capita. It is our choice. We get to make that decision. We've always gone with ad valorem. It's more in our favor. But as Jason pointed out, this is the first year that those tax rates from the municipalities affect our distribution. So those folks that did not go revenue neutral or went above, it affects how much money we actually get as far as sales tax distribution.
So Brian, on that note, and I'm sure that we've got this data, but off the top of your head, how many towns did not go revenue neutral?
I think there were 4 that did not go revenue neutral, and that's off the top of my head.
Sure.
We'll confirm that, but I want to say it was 4. You can't? Yeah. You're gonna look it up? All right. Van will give you the number here in just a little bit.
So 4 went above revenue.
That's my recollection, but Van will give us the exact number here in just a little bit.
And I'm assuming that the percentage above revenue neutral that certainly plays.
It
Yes,
does.
sir.
It's got the impact.
It has an impact as well. And also, I mean, obviously, this is all factored into it, but, you know, our fire departments also get a portion of sales tax. So that's all factored into all of this.
But a lot of the talk around the county, especially the past month, has been increase in property values and how it is perceived that the county raised taxes, and we've been saying that we stayed revenue neutral except to pay for the voter-approved school bonds.
Yes, ma'am.
So what you're presenting to us today does show that we stuck to revenue neutral because the towns are getting more money and not the county.
Yes, we are going to grow with some sales
Organic
tax,
growth.
but not as much as we would have had all those jurisdictions gone revenue neutral.
And just to clarify, it is also my understanding that our tax administrator did meet with each municipality before they approved their budget to let them know what their revenue neutral would be. And then 4 significant municipalities chose to go much higher than revenue neutral.
Yes, he did actually meet and discuss with them our reappraisal as well as their revenue neutral rates.
Okay.
Yes, ma'am.
And so I think this basically answers or shows that we did stick as close to revenue neutral as we could and still pay for the new school bonds.
Absolutely. And this board has been very clear that your tax increase, the rate increase, was only because of the voter approved debt for schools. That was the only reason that the board changed the tax rate. Now, Keith, of course, I always like to point out that the rate came down because of the revaluation. It just didn't come down all the way to revenue neutral because of the voter approved debt. But so people don't realize that it went from 53, I think almost 54, all the way down to 58. Went from 58 all the way down to like 43 and some change. So.
And I would just add too that, obviously the assessment that we just went through, that wasn't just a Union County thing. That was something that had impacts far and wide across our state. And it's not Union County. It's not just Union County that's been affected by it. Now, I think it's also important to understand the concept of rate neutral. So, if you want to make, Brian, if you want to make a comment on that too.
I will be. There's nothing neutral about rate neutral. Essentially, all that means is we're not changing our rate. They're just packaging it in a different way. So if your rate is, let's just say, is 20 cents on the 100, and we do a revaluation, they just leave their rate at 20 cents on the 100. That is a tax increase.
Correct.
There's no way around that. That is an increase. Your rate may not have changed, but how much people pay will go up. So yeah, that's just a way of branding, a tax rate increase.
Yeah, and obviously, I mean, if the assessed values go up, then I would argue that the responsible thing to do would be to lower the rate in the face of that increased assessed value. But to your point, if you keep the rate the same, then you are effectively charging your citizens more money because of the assessed value.
Absolutely.
And remind me too, the county with what we did previously, our reduction in the tax rate, that does represent, I think, the largest reduction of any municipal government within our borders, correct?
I believe within our borders, yes, sir.
Because it was around 15 cents, I believe.
Yes, within our borders, yes, sir. I believe you're correct about that. And you made a point, which I do want to stress, is this is a statewide issue. This is not just unique to Union County. Statewide, there were a number of counties that were going through a reappraisal, reassessment, and their values were significantly high. I mean, it's the nature of the market. Our statutorily, we're required to do a revaluation at a minimum every 8 years. We choose to do ours every 4 years to try and sort of soften that, because if you go 8 years, that increase would have been significantly greater than what it was. So we try to, again, level that out as much as possible. The state is discussing some possible tax reform. I will say that there are some things that concern us about what they're talking about, because that is by and far the largest income stream or revenue stream that we have, taxes. And so if you take that away from us, or you minimize how much we can collect, it's going to affect what we do and how we do it. But I understand, folks are always concerned about that, but we're only following the statute.
And to the point about statute, a reassessment can also be triggered, obviously.
Yes.
So although our board's policy is every 4 years to avoid wide swings and wide increases, beyond that, general statute does require that if certain triggers are in effect, meaning I believe that the mark is 115%. Above
Up
this.
or down.
Yep, up or down. So essentially at 115%, then that triggers a reassessment. And then if it drops, if the values drop to 85%, I believe, then that would trigger an assessment as well.
And we've actually been triggered before in the past.
Yeah, and we were triggered this past time.
We just happened to be on the 4-year cycle, so we were in our own time frame, but we would have had to do it if we were not planning to. We would have been forced to actually do a reappraisal anyway.
Yeah, and I think this is important information for the public to know, because although, to your point, we were on that 4-year cycle where it was our policy, even if this board would have said, you know what, we're going to put this off to next year, we couldn't have done so because of state law.
Correct. Yes, sir.
Thank you.
Yes, sir.
I want to add that Central Iowa met yesterday or in the evening after work, and this was a huge topic for the whole state, including the 9 counties that Central Iowa and the municipalities they work with. And they, I know Geraldine is following the tax committee or the meetings, property taxes in Raleigh. And one of the things that they encouraged was for us, or whoever is our members, to please stay in touch with her in Central Iowa, because they're lobbying as hard as they can for us in Raleigh.
Very good. Absolutely.
Any other questions or comments before we move on? Thank you all very much. You really kind of set up the next set of slides here very well. So I want to make sure I walk through this, because this is going to be another relatively large change that we're trying to prepare for. So with the HR1 passage back at the beginning of this fiscal year, back in July, there's some changes to the administrative cost structure and to the way that local governments, state governments, and federal governments work together to provide Medicaid and food and nutritional substances. So in the past, what that administrative cost has been split 50-50 between the federal government and North Carolina, between the counties. And North Carolina is one of 10 states that manages FNS and Medicare at the county level, not at the state level. So if you've heard, when the passage of this, there was a lot of push of administrative costs from the federal government down to the state government. Unfortunately, in North Carolina, that doesn't go to the state government, it comes to the counties. So in essence, what we have done historically is we split that 50-50, with the federal government picking up 100% of the actual food money, or the money that is loaded onto EBT cards. So what we're looking at is an administrative cliff that's going to be taking place in October of this calendar year. And at that point in time, the federal government is going to reduce its part of this administrative cost share from 50% to 25%, effectively cutting in half what they are going to be providing to us to be able to cover the administrative cost of running these 2 programs. The state does not participate in this administrative cost share. So at this point in time, there's not any knowledge that the state's going to step in to be able to pick up this cost. The second piece of this is that they are looking at an error rate penalty. Again, and I want to highlight for you that this is statewide, and that the error rate is based upon the statewide error rate. So in essence, what can happen is that Union County could have an error rate of 3%, but if the state has an error rate over 10%, there could be a 15% penalty for the cost of the program. And so that is another piece that we're watching to be able to make sure this is something or other where we could do our very best and have excellent error rates. But if the state and if the other counties are not as good as we are in that, we could still suffer the consequences for that. Lastly, there's an increase. I'm sorry. Yes, sir.
Jason, let me stop you right there.
Yes, sir.
What historically has been the state error rate? Do we know that information?
I don't know that off the top of my head. I believe that it has been under 10%, but I can find that information and get that back for you, sir.
Yeah, please, if we can circulate that to the board.
Yes, sir.
Thank you.
Forgive me. I want to make sure I make a note of that. The last piece that we're watching is the higher costs associated with the workload. Again, there's been changes in the way the program is done, both for some of the work requirements, but also the recertification process has been shortened from a year to 6 months. effectively doubling the number of times that we have to certify that folks are working or seeking work and going through that process. Our DSS is working very hard right now to utilize technology to be able to meet these additional requirements. But there is a concern that at some point in the future, there may need to be additional staff hired to be able to cover these caseloads that are going to grow as a result of the certification process. So just to kind of give a summary of this, again, on the left-hand side, you can see what was pre-HR 1 and then what is post-HR 1. So again, the federal administrative cost share is going to go from 50% to 25%. The county's cost share is going to go from 50% to 75% unless the state intervenes. Benefit cost share, again, is at 0% right now. Based upon those error rates, it could be as much as 15% for us. And again, that caseload right now has been standard. And what we're looking at in the future is that we're going to have a higher caseload. And we're going to either need to invest in technology or in additional people to be able to meet that needs. And so I can tell you that both from the budget conference and from the managers conference, this has been a point of contention. This, again, is not something or other that is just local to Union County. Every county across the state is having to work through this, and many other smaller counties are facing larger percentages of drops than we are. Again, we're looking at a fairly substantial drop, but we have a larger organization, so we're able to maybe hopefully be able to mitigate some of that going into this. Questions around this before I move to the next topic?
I want to point something out to you guys don't mind. So first off, and Jason said this is it's a function of when the federal government made these changes, they were going on the fact that the majority of states are do this on a statewide basis. We're one of only 10 that do this on a countywide basis. And so everything that was written for that legislation was written and drafted around how states operate and not how it operates for us. So there's a lot of complications because of the way the state chooses to have these programs operate. Now, this is just one of the examples of how our state has decided to push the burden and the cost down to counties, and they step away from it. This is not uncommon. We deal with this on a number of programs that we have. These are mandatory programs. We don't have a choice. We're required to provide these programs. So what it's really going to depend on is the state going to step in and be a partner, or are they going to step back and let all the counties assume all of this burden? We don't know the answer to that at this point in time. There's plenty of discussions going on at the local level and at the state level. We just don't have a good feeling about that. We did have a county association put on, a discussion about this. The impacts are again statewide right now. My understanding is the average across the state is around a $700,000 impact to each county. Ours is probably more like 1.2 million. Okay. Again, we don't know for sure until we get into it. A lot of that is related to staffing because again, the requirements for you having to test your eligibility have gone up, which now means we have to be able to have more people or technology to meet those requirements. So again, I understand why the federal government wanted to put this in place. Unfortunately, we are such an anomaly. They didn't take into consideration the impact it would have for us when they were drafting this legislation. So we'll figure it out. I want you all to be aware that this is going to be a major budget impact, and how we address it, we're not 100% sure right now. We're working on that.
Go ahead.
Since this has been a topic nationwide, and I don't want you to get too far in the weeds, but it's been asked of me, what is Union County doing to make sure that everyone who is applying is truly eligible, that it's not an illegal, someone who is basically not wanting to work and just,
Sure.
just again.
They're number one, they're standards that, they put in place for the program for how we actually test eligibility, and we follow those standards, to the T. Now you saw the error rate. rates.
Right.
And there are errors. I understand that those things do happen. We have been, fortunately, below, I think our error rate has been below 6%, which is good. That's good for us. But as Jason pointed out, this is a statewide error rate.
Yeah.
We can be 2%. And it doesn't matter if the statewide error rate is 12%, we're going to be forced to pay some money during the way it's structured right now. So all I can tell you is our error rate is low. We work very hard to keep it low, but in the end, it may not matter because it's a statewide function.
I think that people just want to hear that we are going above and beyond what is required to make sure that everyone who is applying for this is truly in need and not wanting to skim.
Yes, and what you'll see is some of the eligibility requirements are changing. So it's going to make it even more challenging for individuals to meet the eligibility requirements. So again, I understand it. I applaud the federal government for trying to be more transparent. It's unfortunate, though, that we're going to have a burden that we're going to have to deal with.
Thank you.
So my question is how does Union County staff and even this board work with our federal legislators, with our people in Congress and Senate? Are we communicating to them to let them know that we're one of 10 states that's going to be negatively impacted by that legislation? Because I hear of many county commissioners and county governments going to DC, but since I've been on this board, I don't know that any of us have gone to DC to talk to our legislators, to let them know, even by letter or email, how their vote is going to hurt us back at home.
Sure.
So can anyone from staff talk to the point, what are we doing to advocate for ourselves with the federal government?
At this point in time, we have not necessarily reached out to our federal delegates on this. First off, a lot of the rules were really sort of very up in the air. We're all trying to understand, well, what are the impacts? How does this affect us? It's a little more clear now. I'm going to say this not because I think there's any issue, at the federal level, but my guess is the federal folks are going to look at you and say, that seems like that's a state problem. You should probably go talk to your state. Now, that doesn't mean we won't actually reach out to our congressmen and our senators and say, hey, this is a problem. But I suspect they'll look at you and say, we built this for 40 other states and it works perfectly. Sounds like your state might be one you guys need to work with your state legislators and get this resolved. We will certainly make those contacts, but I think that's what we'll get out of it is.
And to Brian's point, we have been in pretty constant communication with the state. And the national or the county association has also, because this does impact every county. And I think Brian mentioned it. There's some counties that are looking at a $700,000 hit that don't have $700,000 to come up with. So I think the state understands it's a statewide issue. We are communicating the kind of dire straits this puts counties in. Hopeful that the state will do something to alleviate some of this burden. But again, the state budget is in flux right now too. They're not in session right now, so we won't know until. So I think this is preparing for the worst, hoping that something materializes over the next several months.
Yeah, and always what we faced, whether it's this or any other fiscal years, the state they don't adopt their budget at the same time we do. They adopt their budget usually in the October timeframe. So we've already had to adopt our budget and assume what we will or won't get. And schools face that quite regularly. They don't know what they're going to get. And then all of a sudden you get a curveball thrown at you and you're like, okay, I got to figure out how to pay for this. So to Patrick's point, we're working with the county association. We are talking to our state delegation. We're doing what we can, but we just don't know what the outcome will be right now.
And if I can jump in real quick, obviously, I look at this and the first thing that I see is an unfunded mandate. And since I've been on the board, Melissa's been on the board, we've always had this legislative goal that we're going to oppose unfunded mandates. So first of all, thank you to staff for communicating these concerns to the state level. I'm just wondering if perhaps in the coming months, maybe we can get some kind of meeting scheduled with our state delegation, to talk about some of these concerns, hear about some of the things that perhaps they're discussing or even not discussing, so that we get a better picture ahead of, our new budget.
We will certainly work on it. I know we have invited them to this particular meeting. Unfortunately, they were not able to attend, but we will certainly work on trying to put something together. And honestly, guys, it may be that we make a trip to Raleigh if we need to. That might be what we have to do if we can't get them to come here because of their schedules.
So you're saying we can have a special call in Raleigh?
Yeah.
All right, thank you.
This was talked about a lot last night with Central Ina, and they would like, Geraldine would like to be invited if we set something like that up. And I think it wouldn't hurt to have someone from the North Carolina Association of County Commissioners, just to pull everyone into the same meeting.
Any other questions or comments at this time? Thank you. So last, just closing up some loose ends as we discuss the mid-year 26 update. When we're starting the FY27 budget process, there's a couple of things that we need to close up loops on from the 26 budget to make sure that we're set up straight to be able to start the budget year off. We have the second half of the Sheriff's Office pay plan. Again, that was started in January, so that was funded at about 50%. We need to come back in and pick up the other 50% of that funding for that. Same case when we look at the mid-year COLA. Again, that COLA was started in January. It was funded at 50% in 26. So we have to pick up the other half of that. We're looking at reinstituting the pay for performance programs now that the compensation study adjustments have been completed. And we expect a retirement increase. Again, this is not the number of folks that are retiring. It is the cost of the retirement. And so historically, over the past 5 years, we've averaged about 1% growth over that time period. Ms. Lyles has told us that we might expect some reductions in the future, decreases, not so much increases. But again, that will have to, time will tell based upon where the market is and some of the other factors that impact the retirement and the trust fund that goes along with that. Well, I turn from the general fund and go to the education funding formula. Forgive the formatting on this. When we look at the education funding formula, this is the state mandated or expense funding formula. We look at what our provisions were for UCPS or for education last year, both the UCPS and the charter schools. We look at that. We look at the ADM. There is going to be a projected decrease in the ADM for Union County Public Schools. We add on to that the percentage change for ECI, which is the education cost index. So this is similar to the cost price index, but it's based upon the education field. That's at 3.5. That's a little bit high. That may come down by the time we get to the point where we actually put this into use. And so you can see down at the bottom in the step 3 provides you what our requirement is for FY27, forgive the typo there. And so that shows an additional allocation of about $5.6 million going into next year's funding, next year's budget. Questions or concerns around this? Yes, sir.
Just for clarification, Jason, the additional allocation required, that is based off of the state formula, correct?
Yes, sir.
Okay, so that's what is being mandated
Yes,
to the county. Thank you.
Looking at the education debt fund, again, we are projecting an increase of about 1.7. That again is split between the Union County Public Schools, charter schools, and South Piedmont. Again, you can see that split out right there between the two. And then we expect to see bond referendum requests from both UCPS and from South Piedmont going into the fall election. Looking at economic development and the general fund debt funds, again, the EDC fund is projected to increase by a small amount, about $166,000. The general fund debt is projected to increase by just short of $400,000 as we go into next year. And with that, unless there's other questions, I'm going to hand that off to Mr. Clayton.
Before we do that,
Yes, ma'am.
Matt Helms and Reverend Jimmy Benjamin is here from Union County Board of Education. Y'all want to add anything to the discussion while we're here? No? Okay. Well, thank y'all for coming, but I didn't know if you wanted to add anything because we're at this spot.
Right.
So,
I will clarify that I did talk to Dr. Houlihan, and he did tell me that we will get a request for a bond referendum from UCPS. They're working on that number. I think it may be modified and come down some. So once I know that number, I will share that with you. We have and Beverly will go over this later. There is steps that we have to go through to put things on the referendum, and for the jail, it will also apply to UCPS. So we'll have a later slide that talks about that process. But just to let you know, there will be a request from UCPS for a bond referendum. I don't want to go into that number just yet because I don't think it's 100% finalized at this point. Yes.
Yes, sir. Come on up.
I came up to one just to thank you, Mr. Chairman, for the awesome meeting you and I had a few weeks ago, and also Vice Chair, thank you for coming when we met with the Vice Chairs a few weeks later. And I just want you to know that you all have our commitment to collaboration and communication, what we talked about. And we stand ready to do that. I just wanted to at least greet you all coming here today, since you did invite us. And I thought that was absolutely so kind of you all, just to invite us here to the retreat. And I want Van to know I stand ready to go to work in a few months. So.
Thank you, Mr. Chairman. Appreciate that. And obviously, welcome to both you and our Vice Chairman from the Board of Education. We look forward to collaborating with you and your entire board in this upcoming budget cycle, and thank you again for being here.
thank you.
So real quick on that topic, though, about the bond request to staff, that is. So I'm assuming this would be the other element of Parkwood. Is that what we're looking at here?
That's my understanding. There may be some other items sprinkled in there, but that would be the majority of the request.
Okay, thank you.
So I'm going to spend the next couple of slides talking about our health fund, talking about where we've been and what we can expect for next year. Some of the health plan changes that we went through in the past year, I've got them included up here. We had a number of changes to our health plan in our plan design. We switched to a new pharmacy benefit manager in Lavinity. That actually happened a few months before the start of the fiscal year. We switched to a new third-party administrator and a new medical network. We are self-insured, so we have a third-party administrator that adjudicates the claims for us based on our plan that we write. Brighton and Blue Cross Brighton is the approved TPA with Blue Cross, so we have a more seamless processing of claims now through our new medical network. We also had a new dental network in Sun Life. We'd never had that before. And so that is something that benefits employees as well as the county in terms of network discounts that we now receive. We also consolidated our voluntary insurance products under Sun Life. That would be your critical illness, cancer, hospital indemnity, some of those other voluntary plans. We opened up a new employee health and wellness center in partnership with Atrium. And we moved to new electronic enrollment. Employee Navigator is an application we started with. We're moving to Benefit First, which is a more robust application this year, holds more information, and will be more user-friendly for employees. So we made a lot of changes, and the purpose of those changes really were several-fold. We were striving for higher prescription drug manufacturer rebates, which we have started to see. Higher guaranteed network discount savings as a result of moving to Blue Cross and Sun Life, which we have seen some of those as well. We were also able to lower deductibles and make no changes to premiums for employees. We also anticipated getting better customer support, better member experience, and overall in-network coverage. So Blue Cross has a greater in-network coverage of providers than we previously had. And ultimately, just greater choice for medical care. So previously, employees that were on the direct primary care plan, they only could go to the Marathon Clinic that we had. They didn't have a choice. Under this new arrangement, we have a new employee wellness center that they can choose to go to, but they also can choose their own primary care physician through the Blue Cross network. So there's greater choice there. So looking into next year and beyond, we are facing some local and national trends in healthcare. And specifically, this first one is very unique to us. We had our previous TPA, we had some issues with them, which primarily is why we switched. They were underreporting the number of paid and pending claims. We base our future projections in terms of cost of the plan and our budget based on those number of claims. So when you start underreporting and you're not getting all of the data that you need, then your projections start to fall short of what you think your costs are going to be. And that's something that we faced. We do not base our projections on denied claims. We assume those claims were accurately denied based on eligibility of the member or service. Unfortunately, once we ended the agreement with the prior TPA and entered what we call a 6-month run-out period, many of those denied claims switched to paid claims because there were processing errors on our former TPA side when denying those claims. I want to be clear, we would have paid those claims anyway because the employee or the member or the dependent was eligible and the service was eligible. We would have paid those claims anyway. The problem is they came in a very short amount of time. And if you recall, we had to deplete our health fund balance to cover that. And so just to give you an idea, because of these two factors, we had about 5 million of chargeback claims, meaning that the service dates for those claims occurred prior to July 1. Just to give you a sense of the two previous fiscal years, our chargebacks were around 1.5 to 1.8 million. So that is a huge discrepancy and something that we faced. On a national level, just getting into some of these other trends, there are a lot of trends affecting the overall health of people living in this country. It's increasing cancer diagnoses in younger adults, increasing rates of cancer overall, an increasing aging population, which we know we're experiencing here in Union County. That requires greater and costlier medical care, as well as increasing pediatric onset chronic conditions. So not only does this lead to greater utilization of healthcare services overall, it leads to more catastrophic events to the plan. What I mean by that is more high-cost surgeries, more high-cost treatments due to those diagnoses, and unfortunately, even death. Pharmacy costs are rising as well. They are rising faster than medical costs across the nation. And we're seeing this in our health plan as well, particularly those specialty drugs and GLP-1s, which are those weight loss medications, which we do cover. They also affect people who have diabetes. We are required to cover those, obviously, because that is a medical condition. But we also cover them for weight loss right now. They are now accounting for a disproportionate share of our prescription drug spending. And finally, Jason mentioned sort of the inflation rate ticked down a little bit, but overall in the last year, inflation is up overall. And so along with that are costs of drugs, costs of treatments, medical equipment and supplies, services rendered by medical providers. All of that is built into the claim cost once we pay it at the end of the day. So that's sort of what we are facing. So what does this mean going into the next fiscal year? So first of all, we need to replenish our fund balance. We plan on using some unassigned fund balance to do that. You'll see that on a future agenda item. What we're doing is really targeting what that amount should be, looking at the claims that are coming in for February and March, so that we have a better idea of how much we need to contribute to replenish that fund balance. We need to consider changes to our health plan design overall for FY27. We need to be looking at deductibles, premiums for employees, our prescription drug coverage, and how we do that because those pharmacy costs are going up. So those are things that we will have to change for FY27. But more importantly, I think we want to take a long-term strategic approach to managing the health plan. So we have a benefits consultant that we're going to be working with, and we have been working with for some of these changes. But now that we're in the plan year and we've made these changes, we can better project. I think we're getting good data now from Blue Cross. We can better project what some of those long-term changes need to be so that we're not in this situation going forward, so that we are planning for some of those catastrophic events, those trends in pharmacy, as well as sort of just the general utilization of healthcare services. So I just wanted to give you a preview. We will be coming back to you at some point. We'll be communicating to employees as well as to you all sort of what those plan design changes here in the coming weeks.
I want to make sure everyone understands that this is not a symptom of that we changed our insurance and that's what is driving all of this. We would have had these cost impacts regardless of whether we changed our insurance or not. Now, what we did uncover is that past TPA was underreporting, so that obviously was something we didn't anticipate. But these costs for pharmacy, the costs for medical costs and the treatments, we would have dealt with those regardless of what carrier we're with. We're self-insured, so that means that we're the ones who have to fund all that. And Clayton threw out a lot of words about fund balance. I don't want you to get confused. We have a healthcare fund balance, and so that healthcare fund balance is what we have for those claims. And then we have an overarching fund balance that is just county-wide. What we use to pay those claims that were out was our healthcare fund balance. Well, now we've reduced that. We need to use some of our overarching fund balance and put that back into that healthcare fund balance to make that whole so that we have that for the future. Because if we throw that out and some folks are like, well, what do you mean by that? There's a big savings account and then there's a little smaller savings account. And that's how we structure that. I also want to circle back around on the questions about the taxes. I was way off. 13 of our municipalities went above rate neutral. 13. I'm sorry, above not rate neutral, revenue neutral. Thank you, Jason. 13 went above revenue neutral. 2 actually went above their past tax rate. So they didn't even stay rate neutral. They went above their rate that they had in the past. So again, I was way off. I thought it was 4, but nope. All 13, Henry Bridge doesn't count. They don't have a tax rate. I love them, but they don't have a tax rate. So the other 13 do, and they all went above revenue neutral.
Brian,
Yes, sir.
when you say they went above revenue neutral, they just kept their rate where it was.
So they may have, so I'll give you an example. Let's just say their rate was, that for 26 was 15 cents. And revenue neutral would have been 10. They may have gone somewhere between 10 and 15. They didn't stay necessarily at 15. They just went somewhere between the two. 2 actually went above what their rate was. If their rate was 15, they went to 17. So I can't say for a fact that they stayed at their rate. They just went somewhere in between what revenue neutral was and what their formal rate was. But the essence is, that's an increase in taxes.
So I want to ask a question along that line. So we've had, town councilors or mayors say they did not have a tax increase. And the constituents believe that their taxes went up because of the county, not because of the town they lived in. So when our tax office goes and meets with these municipalities, do the elected officials hear this number or just staff? Because I'm beginning to wonder, if our tax administrator shared with staff what revenue neutral would be, Did that message get carried over to the mayor and the town council?
Van, can you answer that for me? Yeah, if you wouldn't mind. That way we've got it on camera. Got you on camera, Van.
So last year was a reval topic. I didn't expect that for this year. So we do not get into the rate calculation. We talk to them about their assessed values. So they are responsible, each jurisdiction is responsible for their own revenue neutral calculation and their own adopted tax rate. So that is not something we give them. Now we show them the percentage that they're increasing compared to their assessed value for the prior year. To talk about the tax increase, we'll just use some general numbers. If the overall county value increases 58%, okay, which is about what it was. It might have been a couple of decimal points different. If your value, typically speaking, there are exceptions. If your value goes up less than the median of 58%, if the jurisdiction goes revenue neutral, you should not see a tax increase. If your value went above that median number at revenue neutral, you will pay a little more in taxes. Now, each jurisdiction has their own rate. So hopefully that helps clarify a little bit. Taxpayers' bottom line are just looking at their bill amount. That's what it comes down to.
Not really, because I still think there's a communication. I'm wondering, because there's been so much misinformation since the revow.
Yeah.
And citizens believing that the county raised their taxes when we stuck to revenue neutral, and we see you can see we're not bringing in much extra money this year, but the municipalities are bringing in significantly more money this year. So my question really was, who are you meeting with? Are you having this percentage conversation with staff, or are you having this with staff and the elected officials? Because I know firsthand there are some mayors and town councils that are adamant that they stayed revenue neutral, but according to our calculations, it's like 103% increase.
So every one of our meetings is a public presentation. We did 33 public presentations
At their public meeting.
at their public meeting.
Okay.
With every town council member. I mean, I say every. There were meetings that there were some towns the mayor wasn't there for anyone that we went to. There were some that there were certain council members missing. So it just varied based on jurisdiction. But we went to every jurisdiction at least twice.
And Van,
At their regular meeting, or was it a special meeting?
Their regular meeting, yes.
meeting. Okay,
Yeah.
thank you. That's what I was wondering.
And Van, there is a statutory way to calculate revenue neutral, correct? That is laid out in the general statute. So these towns should be calculating that the same way.
That's correct.
Not all of them probably do calculate it the same way, but it is laid out in the general statutes. And you are also required, as part of the budget process, to present the revenue neutral rate to the board. They obviously don't have to adopt it, but it does have to be presented as part of that.
And part of that calculation, and I know there's been discussion over the years, well, that's not true revenue neutral, this is true revenue neutral, and back and forth with different people. But you are allowed to realize your standard average growth rate as part of that revenue neutral calculation. Okay. So if your growth rate is 3.5%, you're allowed to capture that normal growth pattern within that revenue neutral rate calculation. If that makes sense.
If I can just kind of summarize, I think what has been asked here, for particularly some of the elected officials who are wondering, why is it that you've gone up, but nobody in your jurisdiction thinks that you've gone up?
Correct.
As Van mentioned, all of those presentations were made to the municipalities in public meetings. There is a legal requirement to publish the revenue neutral rate. Base goes up 58% tax rate should come down. At some point, you hit revenue neutral. They're required legally to publish that rate. So not only did they hear about it twice, but the jurisdictions themselves are legally required to publish that revenue neutral rate. And then they can adopt whatever they want. Everywhere from rate neutral, which if the base went up 58% and you keep the tax rate the same, is about a 58% increase in revenue collections, roughly, all the way to some people that went over that rate. So they compounded the increase that would have stood just because of the valuation increase. I don't know who's talking to who or what those kind of, I'm not privy to those, and I don't represent any of those jurisdictions, but they should be extremely well aware of what their rates are.
And I know some of the municipalities, they had some fees that they charged, and so they moved those fees from a fee structure to absorb them into their general fund. And so they adjusted their tax rate to accommodate for that expense. So that was some of it. I don't know what every one of them did. Obviously, I'm not part of the budget process, other than just giving them revenue projections.
So to close the loop, this has been very informative. Thank you. Taking out Hemby Bridge, who does not have a tax rate, that leaves 13 municipalities, and you stated all 13 had an increase.
Based on the chart that we have, and I have access to, came from budget as well, every jurisdiction went above their revenue neutral tax rate. Some of them two of them went above their prior year rate, but I think those are situations where they moved fees from a fee structure to general fund. Some of them were just minor percentage points above revenue neutral. Some were 4, 5, 10%. Yeah. So.
But that's our recommendation, is that every one of them went above what the calculated revenue neutral rate would be.
And what would be an example of how a municipality published this? Published how and where? On their website? Or
I think there's a couple of places. One would be their website. Two would be just like in our budget document, there's a statement in their adopted budget document that states what the revenue neutral tax rate would be. Now, again, based on the percentage of increase in value, even if you go revenue neutral, you still may pay more in taxes.
Yeah,
the revenue neutral piece is just the bucket of overall revenue for the jurisdiction.
Taxes are complicated, and the average resident, obviously, they don't deal with this on a daily basis. And when they hear, well, I'm at revenue neutral, and so you are at revenue neutral. What Van is saying is, even if you stay at revenue neutral, if the value of your property went up so significantly high, you are still going to pay more in taxes just because the value of property went up. There are some people whose value went up but didn't go up significantly, and they actually pay less in property taxes. That's that's not the commonplace that happens, but it does happen. And so, unfortunately, every individual is unique as to, well, what is the value of your property? Did you add a bunch of things to the property to make it more valuable? Do you live in a jurisdiction that raised their tax rate? Did the fire department's rate change? Those are all things that affect your ultimate tax bill. And so we encourage folks to, if they've got questions, we'll be happy to try and address them as much as possible. But there's not one answer that will be unique, that'll be for every single person. Their circumstances are all individual.
And I would add across property types, because everybody pays vehicle taxes as well. Across property types, when that tax rate goes down, you're going to pay less in tax on your motor vehicles. You're going to pay less in tax on any personal property, just because of depreciation and the reduction in rate. I think there was a question earlier about the amount the rate went down. I think it was you, Chairman, about the amount the rate went down. If you look at the last two reappraisal cycles, 21 and 25, the county's tax rate has dropped by 30 cents. It was 73.08 prior to 2021. And that year, in 2021, the rate dropped to 58.8, and it dropped again this time to 43.42.
Thank you for that. I appreciate it.
That's very good.
Thank you, Van.
I've got one question regarding healthcare. Actually, maybe two. But Clayton, when you were presenting the information there, one of the bullets that you had was a new electronic enrollment. Forgive me, but is the electronic enrollment, is that something that's entirely new, or did we just, is this like a new version of it?
It was entirely new last year. We had done everything on paper before, so it was entirely new last year. What we've done now is we've got a better product, we think. Employee Navigator was one that just got us through so we could do it. We've got a better product now, and all of that comes free to us because we use our benefits consultant because of the relationship we have with them. So we're getting a better product, and we'll be using that open enrollment this year using that product. So.
Wow. Okay. I would imagine that that paper enrollment was a very labor-intensive endeavor.
Absolutely.
Yes.
So that's good to hear. And one other question regarding, I think you said prescription drugs and how we are disproportionate. Can you expand a little bit more on that in the context?
Sure. So in terms of where our prescription drug increases, like the cost of increases, when you look at the medical claims, right, just for medical services, those are going up as well because of all of that increased utilization. But the cost of the drugs are outpacing the increase, which is not something you typically see. But it's because of these specialty drugs that cost a lot of money. Sure. The GLP-1s in particular are a huge impact to us. Just the increase in those new prescriptions and new drugs, you see them all the time on TV and the ads. That is astronomically increasing.
Okay, thank you.
Yes, sir.
I'm going to talk briefly about our Community Partners Program and then the opioid settlement funds before we all get caught up in this storm that appears to be coming through in real time. We work with a lot of our area nonprofits in a bunch of different ways. One of those ways is our Community Partners Program. This is an annual application period that our budget department does, and area nonprofits can submit for funding through the county program. It is a ranked metric that budget runs through and comes to the board with a recommendation. It's basically a graded number that says, yes, we think this is a valid project that serves a public purpose that we should fund. Some of the challenges, this program has grown pretty significantly in recent years. You can see we're a little over 300,000 in 2022, and now we're approaching 750,000. In light of some of what we're dealing with on the HR1 and the health fund, we would like to level set funding this year. So basically keep it what it was the previous year. And we want to come back to you all with a program sometime in the next budget year that's a little bit more sustainable and can maybe spread the money around a little bit more. Some of these nonprofits have been getting funding for a decade, which is not a bad thing necessarily, but it prevents maybe some new nonprofits that want to do something different from accessing those funds. Maybe looking at doing this for more one-time expenses than ongoing operation, just so there's a start and a finish to the project. So this is a list of all the funded partners from last year. It is in your packet. And this is not the only way we fund some of these nonprofits. Council on Aging for Access has access to home and community care block grant funding. Some of the JCPC programs get funded through this, our opioid settlement funding that I'm going to talk about in a second. Some of those. So this isn't the only funding they get from the county, but we would like to pause this program for a year, keep them levelly funded, and then come back to you with a more sustainable program next year.
And I just want to add to that is that, a lot of these folks, they count on those funds, obviously, for what they do. And so they can and may reach out to you and say, what's going on? Why is my funding going up? We're not cutting anyone's funding, but we are going to be evaluating what do we do with this funding in the future. Because again, there's only so big of a pot. And unless the board decides you want to put more money in the pot, there's a whole lot of folks who are asking for it, and we really have to decide, what is the best way to spend those public dollars. So just be aware that our plan this year is just to be flat and level, and then we'll come back to you with a strategy for what we do in the future and what those organizations are and why we think those are a good fit for those public dollars. Thank you.
And opioid settlement fund update. We had just wrapped up our strategic planning process, and I want to give a big shout out to Maribel, who has served as the program coordinator for about the last 7 months on this. And it's been about a 7-month process where we have met with community partners, we've met with local law enforcement, the DA. This is truly a countywide effort that we've wanted to get as much input as we can, because these opioid deaths, these opioid overdoses, they affect the county from Marshville to Marvin. There's no one single area of the county that is affected more than others. So it's truly a countywide issue. So we had a series of 6 meetings where we invited them in to talk about what they're seeing in the community, what their needs are. And from that, we came up with these 11 strategic priorities. These are not specific funded groups or items, but this is how we plan to come to you all with a recommendation, that it's got to fit into one of these 11 strategic areas. Just a date, RFA, request for proposal, what's the application, request for application. So we have sent this out to the community, said if you want to access opioid funding, you got to put a request for application. You can see the timeline. We are about a week away from applications being due. From that, staff will put together a recommendation to the Board of County Commissioners, and you will probably see this in April. Again, these are the national settlement funds, and there's a very long runway. We are 3 years into an 18-year program. So some of the programs that we have established, like the Veterans Treatment Court, the Opioid Treatment Court, we want to make sure that we can sustain those through the whole 18 years. So we're being very careful not to overspend on the front end so we don't have the money to support the program throughout. So again, you will see this. There is a copy of the strategic plan. Is it in their folder? Maribel has a copy of the strategic plan, so we encourage you all to pick those up on your way out. But just wanted to give you a quick update before you see this in April, so I can answer any questions y'all may have on this. Thank you. And I think we're at our first break ahead of time.
I was only supposed to do this one time today. We're here to talk about, this is queued up. Oh, wrong way. We're here to talk about what we've labeled a smart tax administration initiative. This is more about sustainability within our office from a software perspective and equipping our people to do with the tools necessary to do the job that we need to do from here into the future. Why can I not see this? I'm going to move out here just so I can see this a little bit. This is a modernization effort that we want to undertake or need to undertake in our office that's going to attempt to leverage technology, data analytics, and more automation into our workflows. It aligns with, I hit the wrong button. It aligns with the county's strategic plan and the county's objectives from a sustainability standpoint and organizational strengthening, which is the big underlying factor here. The project goals and overview is to streamline our workflow, automations and process standardization, enhance our data collection capabilities with real-time data access in the field. Similar to, I would compare it to the inspectors having access to their workflow and their work that they need to do in the field, whereas our people, I think, Brad, and I've got 2 of my staff members here today. I'll take a moment to introduce them. Brad Helms is our appraisal manager. Kristen Foxworth is one of my 2 deputy tax administrators. They came today just in case any questions that I can't answer happen to pop up. But to that second bullet point perspective, we spent 2 days this week printing 25,000 property record cards on paper for our staff to go out in the field and work. We need to change that. We need something digital that they can do everything on a tablet. It flows into the system to prevent that redundant work process. We need to enhance our data analytics. That's becoming a key part of our processes in our job, is to manage the data, manage the studies, the statistics, to keep them in line with international standards. We think this will strengthen our quality control and our audit functionality, but from a tax relief perspective, personal property as well. We know it will improve our customer service and transparency. Our data, we tell people we're an open book. Everything in our office, with very few exceptions, is public record. And we've got as much available as we can online. We think this change will help facilitate even more of that, make the information more available. And we want to leverage technology right now versus projected needs of additional staffing. If we can leverage technology, absorb some of that workload, then look at the staffing after that. Just a brief history of our software that we've had in the office. Going back to the 90s, we had a product called CLT, which is appraisal software. And then we had an in-house AS400 billing collection software. 2000, Brad was actually here for all of this. Brad's been here a while. 2000, we brought in a company called CPS for the appraisal side. We maintained our in-house billing and collections on AS400. I came in 2004. There was a software project that was underway at that time that had failed. The tax administrator, when he hired me and another individual who retired a couple of years ago, he said he had been given a directive from the manager at that time to get it working and make it happen. So we did that in 2004. It's a company called Manatron. We stayed with them until 2012 on the billing collection side. We continued to work on the county side with their product called ProVal up until 2018, 2019. They stopped supporting the system that we were on, and what they wanted to move us to was cost prohibitive at that time. We was in the middle of the recession. Everything was just going south, and so we had to do something more cost effective. So we went with a company called OneTax. Again, it's going backwards in technology. The AS400 platform mainframe, green screen for those of you that have seen that in the past. In 2016, the county made the decision to move on from the AS400 that was in-house. People were aging out that could support it. They were retiring. And so we didn't have the support that we needed from an IT perspective. We went with a company called DevNet. They're based in the Midwest, in Illinois, Missouri, Iowa, particularly heavy. From our standpoint, we brought them into North Carolina with Gaston County. It was a joint project between the two counties. They've since added a couple of more, but we've been with them since then. Some of our challenges, as you heard me hit on, lack of mobility. We have limited external access because of the structure of the program and the database. We do have downtime and stability issues with the software. Excessive manual duplicate data entry processes. There was a lot of our work for the reappraisal that we had to do outside of the system and then move the data into the system from a valuation perspective. Just could not get to where we needed to go. We do leverage third-party solutions, consistency in reporting. Sometimes we'll run two reports that should bring us the same information, but they're a little different. So we have to verify and cross-reference and rectify those discrepancies. Excessive reliance on help desk support, and that is not our help desk. They are great. From that standpoint, we, on average, keep about 80 to 100 tickets open just on our tax software with the help desk. So that's significant. Eats up a lot of our time and prevents a lot of work from being done. And the final bullet point here, staff turnover. That's why we're doing this now. I'm looking to do this now. Clayton and I were talking about this, and he asked a question that I thought of, but really hadn't thought of. When we went with DevNet, I knew that contract would take me through the end of my time in Union County. It also takes a number of other staff members and our senior leadership through the end of their time in Union County. Then everything expires, you've got to start over. And so our goal with this is to get ahead of that and start a project that can bring in a long-term solution to the county, somebody that we can partner with for the next 15 to 20 years and leave everything in a good spot. and that's why we're considering this change at this time. Our next steps with this is we are going to issue an RFP, hopefully late March, early April. We're in the final stages of drafting that now. We'll be reviewing responses and vendor interviews in June, with final negotiations and a possible contract execution in July. Our goal with whoever we go with from this project will be a go live by December 2027. It's an aggressive timeline. It's a big job. This will be I think I told Clayton, this will be my 4th software project since I've been with the county. I never intended on doing another one. But that's where we're at, and it needs to be done, regardless of the solution that's selected. It is part of the manager's recommended capital budget for FY27, and we're looking at an initial cost, and we're estimating we quoted for the capital piece of it, which is the installation, training, data conversion, initial deployment. It's going to go anywhere from $1 million to $1.5 million for that first piece. The annual support amounts, we currently pay roughly $220 a year for our software, for annual support, maintenance, training, and those aspects of the agreement. Right now, we're seeing the ranges of new vendors anywhere from $150 to $350. So it's going to fall somewhere in that ballpark. On the higher end, we believe we will be able to decrease the leverage that we currently have on some of our third-party software, so that we shift some of that funding from one contract to another. We just don't know how that's going to play out until we get to that point and review everything that the vendors propose. With that, I will take any questions, address any concerns that I can at this point.
So, real quickly, what Van is talking about is what you're going to see when you see our recommended CIP, the information technology, is you will see this when we bring that probably at the May meeting, the first May meeting. So that's what he's saying is you'll see that as part of our recommended. And he's right. This is something that I was a little worried because when he's scheduled to leave us, and we want to hang on to him as long as we can. A lot of his senior staff will be probably exiting around the same time. We would not be in a great position if we were trying to implement a new software after the next reappraisal without key staff. So this is something we really need to ramp up now so that we have a sustainable solution in the future. It just so happens that it's going to provide us a lot of efficiencies across third-party solutions, as well as efficiencies out in the field to help us, alleviate some of the workload for staff and, absorb some of that staffing increases that we would typically see.
So Van, first of all, let me say thank you. Thank you for your service to the county. Thank you for everything that you do for every resident here. If you can go back to the implementation timeline. Yep, that one right there. So I agree with you. That is an aggressive timeline because at least in my professional career, I've been through some similar implementations. And so a couple of questions that I've got, and maybe we don't have the answers to this just yet, and that's fair if we don't. But as far as the implementation here, are we dependent on inside staff for the implementation, or is this something that would be negotiated with the vendor?
It's a combination. So to Clayton's point, one of the questions when this first came up, one of the questions he asked me was like, "Can this be done after you leave?" And I was like, "It's not about me leaving." And then I was thinking about a lot of the key players that will be involved from our staff perspective are going between now and when I go. So it's almost a tiered effect. I took over the office in 2017 as administrator. We've been through one wave of retirements. We've had a little bit of a lull. We're getting ready to start the second part of that tidal wave. And it's going to be between the two, probably 15 people, a third of our staff, retiring in a matter of 8 years total. From looking back 3 years to moving forward 3 years, it's about 15%, a third of our staff, 30%, give or take. Those people will be key. So it'll be a combination of certain IT staff from a network perspective, the vendor, our current vendor, providing access to the data that we need. And they will be in the running. They have changed their platform. We're just not on that platform. But if we wanted to stay with them, we would need to go through this RFP process to move because there's additional cost involved. So there's a number of factors, but it will be a team effort from an implementation standpoint. And that timeline takes us through the end of our current agreement with them. December 27 is when our current extension with them or renewal option with them expires. When we did in 2012, when we had to convert personal property billing and collections, we did that one in 90 days. And it was mostly flawless. There were a few data issues, but we corrected them and moved forward. This one will be a little more complicated than that one. But we feel like if we can hit the first 2 or 3 of these timely, talking to some of the prospective vendors, they feel like that gives them plenty of time to get us potentially active by mid-October, early November, so then we can have dual systems running and make sure that we're good on this side, everything's matching up. And then once that other one expires, then we're good just to move forward.
And would this timeline also include any kind of necessary training for county associates as well?
Yes.
Okay. All right. Thank you, Ben.
Yep.
So we are well ahead of schedule. So far ahead of schedule that our next presenter is not quite here yet. So I think Maribel, you said lunch is here. So I think what we're going to do, if everyone's okay, let's get lunch set up. We'll eat a little bit early, and then when Mr. Boyd gets here, we'll get into the major capital presentation.
Absolutely. I do want to say, if you'll notice the theme of some of the things we're trying to do, we're trying to leverage technology to try and reduce the impacts on staff increases. There's going to be some times where a staff increase is what you have to do, but we are trying to do our best to make sure that we find ways to do our work more efficiently without having to necessarily add staff to that. And that's one of the things that Van was talking about, that technology there is also going to help reduce some of our staffing issues as well.
Well, and I'm glad that you brought that up because, that's something that this board has questioned from time to time. Where are we at as far as our efficiencies with staffing? Because I think, historically, and I don't mean to speak for the board with this, but I think that by and large, this board supports, more of a smaller government, limited government, and to staff's credit, we are one of the most lean and most efficient county governments within the state. So I certainly appreciate staff trying to keep that in mind as we move forward. We want to be as efficient as possible, and obviously, software can only do so much, right? I mean, we still have to have people, and we have to have good people. But where we can, make efficiency gains, and I think it's well within our interest to do so.
Absolutely. I want to take this moment just to say, number one, thank you for recognizing that. You can look around the state. There's a jurisdiction that's having some woes right now. It's Rocky Mount. I'm from Rocky Mount. And their manager left them in a bit of a lurch. They're like $100 million in the red because of things that their manager was doing and allowing and approving. And I just want to point out that you've got some very good staff here. Not me, all the folks around me. And they keep us in line, and they make sure we don't do things to get ourselves in trouble. So you have got a great team working for you here in Union County, and they do good work. So I just want to point that out. So thank you.
All right, so I think we're going to adjourn. Lunch is almost set up, and then we'll try to probably get started back at about 11:30 instead of 12 for the major capital update. So we're on break till then.
That's right. Story of our life.
Go ahead. Well, I guess it's good morning or good afternoon. Almost good afternoon.
So, all right, Verdict, what do you think of the camp store?
It was great.
That's a nice-
See a fireplace.
And shelves and furniture and all that. So all that's on.
Merchandise, yeah.
Anyway, good morning. Thanks for giving me a little bit of time to talk about a few of our capital projects. We got a lot of projects going on, but we want to focus on 4. First was the jail. We're going to kind of move that around just because we changed the time and one of our consultants can't be here yet. Talk about the South Piedmont Regional Autopsy Center, the Water Ops Center expansion, and the Solid Waste Ops expansion or new building over there. So we're going to move around a little bit. I think we're going to start with the South Piedmont Regional Autopsy Center first. So talk a little bit about this project. Right now the budget's sitting at about $20.5 million. So we got a $20 million grant from the state. We've utilized a little bit of operational funds to help with some design costs on the project. So that's where the $537,481 come from. The scope of the project right now, we're sitting at 15,100 square foot of building. And I've got a floor plan. I'm going to go through some of this, with you to talk, a little bit about the specifics of the layout. But in general, we've got 4 main autopsy stations. We've got 1 decomp or isolation autopsy station. Coolers that'll hold 93 decedents or bodies, 77 in the main cooler, 16 in the decomp cooler. Then we've got an x-ray room, specimen and evidence storage areas. We've got offices, I think, to support 13. Some of them are open offices. I think there's 7 regular offices. 6 regular offices and then 7 in open workstation area. Conference room, lobby, break room, locker, and changing rooms. We've got enhanced mechanical systems to support low temperatures and humidity, concerns over there. So pretty expensive systems there. And an important consideration is that our site plan, and I'll go over site plan a little bit, it does allow for future expansion, and there's 4 kind of spaces that I'll talk about when we get there. So then the project budget right now, as I said, $20.5 million. If we've got designers our designers are CPO architects, and our construction manager is Wharton Smith on this project. So a breakdown of what our current budget or budget estimate is right now, and this is based on design development numbers. You can see we're at $20,980,000. So we're a little bit over budget. We've got strategies to deal with that. It's not atypical that at design development that you're a little bit over budget. It's about 2.2%, which is, actually very good. So there are still some operating reserves that we potentially can put towards this project to the tune of about $500,000. And we are we're in the process for value engineering right now. We think we've identified between $250,000 to $300,000 in value engineering items. So I don't see us having too much of a difficulty getting back to budget. Now, I'm sharing DD numbers. We actually are in construction documents right now because we're trying to turn this over quickly because we need to open it in order to meet the kind of the state statute for the funding requirements. So I've got a couple of renderings. So this is what the building's going to look like. Not very impressive. We didn't get as far as the rendering. The building's going to be impressive, but the rendering's not very impressive. This is looking north. If you looked at the top of the tree line, that would be where Highway 74 is. And the site plan will explain this a little better when I get there, but just want to show you some renderings of what it's going to look like. This is a view from looking east. Next one is our our site plan. Some things to point out on the site plan is, so at the top,
You can take
Okay.
it.
You can take it with you, I can like with it.
Oh, well, I guess I can. Okay. All right. All right. So, and this doesn't show up. So at the top, you'll see DOT is requiring us to do that 74 at the top. We have to align our entrance road with the street, which is Edgewater, I think is the street that you've got to. Yeah. Okay. Edgewater Street. We had to do a decel lane on both sides of 74, and you can see those shown there. I mentioned about expansion. If you look at the green, red, blue, and yellow, those are future expansion areas. So the green is the potential forensic laboratory expansion. The red is the autopsy suite expansion. Blue is a cooler suite, and the yellow is the office expansion. Let's see. So you see visitor parking at the front entrance. Big stormwater pond. So we actually have sized that based on potential future expansion of the building, so we don't have to build another pond when the time comes. There will be a security fence that comes off the public area. It comes in front of this secure staff parking lot. You'll see Sally Port area, and then mechanical yards to the north and the east side of the Sally Port area. Moving on to a floor plan. So it's interesting to note on this project, there are, I call them 3 distinct areas, but you could kind of probably break it down in 2. So the primary part of this facility is in the north section. Now, I wish I could draw this, but I can't. So there's basically a delineation in spaces from here over to here that basically is what we call, what designers call the stink wall. So basically, it's to isolate, so those walls go all the way from floor to roof. And that's to keep odors from the autopsy side to getting into the administrative side. It's an important part of this, of this design. So you can see we've got 4 autopsy stations. And there are, in those 2 areas, there are distinct HVAC systems, of course, that are meant to keep everything separate from an airflow perspective. So you've got 4 autopsy stations. You've got the regular body cooler. Then you've got the decomp cooler, decomp station, X-ray, and then specimen storage. You've got spaces for morgue techs. Spaces for morgue techs. And then you move over to the administrative side. You've got a break room, the offices for pathologist, office manager, director, and then the open office area, conference room, and then, of course, the lobby area. See if there's any other, some things to point out. You'll see our mechanical yard that's outside is probably better on the site plan, but we're going to have 2 chillers for redundancy's sake. You know, you lose one chiller, you can operate the whole building off another. We'll have a generator that's a full building generator, so in case of emergency, you can operate, you know, the entire facility, not just a portion. You'll see this is actually a mass disaster bay. So if there was a need to have a short-term expansion of coolers, you basically pull a reefer truck up to that loading dock, and that extends your you know, mass casualty event. You can have additional storage room there. Another thing to note, this is going to be a highly secure building. card access controls, but also on the administrative side, especially on the public facing side, we're going to have ballistic glass. Right now, level 5 ballistic, but we're probably moving down to level 3, which is kind of what is normal for autopsy centers. See, so you'll see it's a little over, I think it's like 55% of the square footage is dedicated to autopsy space. So it's not a lot of space is dedicated toward just administrative space. All right, so talk a little bit about the schedule. So I told you some of this information is based on design development phase, but we're actually in construction documents. We are pushing hard to finish up construction documents the end of this month. So we've got 2 more weeks to kind of get that wrapped up. That puts us, we've basically in county government, you got about 4 months of bidding and contracts, execute contracts. So if all goes well, we get design done in March. We'll be started construction in August of 2026. This is a somewhat complicated construction project, so we're figuring 15 months of construction on this project. So we're finishing up in November 2027 is kind of our target right now. So, it's a little later than we had initially wanted, maybe a month later than we initially wanted, but we're tracking pretty good on this project. All right, so that's all I've got on the construction side, design and construction side. Any questions about anything?
Well, you specified 2 different type coolers. I'm a little bit slow to even ask, but decomp cooler, what is?
Those are bodies that have decomposed more than someone, a normal death that goes, directly from the hospital to the morgue, something like that. So it's a decomposed body.
Gotcha.
And there could be, and Dr. Pavet's here, he can maybe explain that a little better, but, there could be some cases where you want to isolate a body, not a decomposed body, that can go in this space too. Yes,
So,
sir.
Chris, thank you for bringing us such a cheery topic.
Yeah, thank you.
Thank you for, I was going to say thank you for doing it after lunch.
Hey, look, this is not, this is the first that I've ever built. I toured 2 morgues and they were active morgues. So if you've never been in one, it's a different exercise. You got to be ready for it.
So I do have a question or 2 here. So if you can maybe flip back to, I think it was the first slide where you talked about the project budget.
Will that one work?
Next, there we go.
Okay.
So a couple of questions here, and I understand I'm certainly not an expert on an autopsy center. I think we're all kind of figuring this stuff out as we go to a certain degree, but my question is the size of this facility. How does that compare to other facilities in the state? Are we about the same size? Are we smaller? Are we bigger? Because for me, I have no point of reference here. So if you can shed any light on that, I'd appreciate it.
Yeah, I would say it's very comparable to Mecklenburg. And Dr. Pavet and Stephanie can talk about that a little more when they come up, talk about operations, but it's very comparable. We toured one, and this is not the state, but we went to Florida and looked at one, very comparable there too. It's a little difficult, I guess, to compare the sizes. There's a lot of data behind how many autopsy stations you really need to have. And I think where we're landing on 3 was a safe bet, but really, you've got, 3 is an odd number, and, making things symmetric and all that. It just lined up with doing 4. The body count is another pretty scientific evaluation of how many spaces you need for bodies. So I would say we're very comparable. We probably started initially in programming at about maybe 17,000 square feet. and pushed and pulled things to meet budget. But I would say overall, we're pretty comparable. There's a couple that are going on now that I think from a population perspective, that we're pretty in line with what they're building based on population. That's the best I can probably do for that.
Yeah, if I can just jump in, I think we are comparable to Mecklenburg, and obviously they handle a lot more autopsies than we're handling, which we're going to get into. We're going to talk a little bit about operations and how much we handle. So in general, I think a pathologist typically handles 250 to 300 autopsies a year. When we are fully staffed, and you're going to see this, that with 4 pathologists, that would be about 1,000 or more. We're at 500 right now. And when we'll get to this, but when we assume Gaston County come June, we're going to be around 500. So this facility is built out for about a 20-year expansion already. And we've already built other expansion areas and pre-planned for those. So we are right on target for what the needs of the 9-county region is going to be. But in terms of like the number of autopsy stations and pathologists, we are similar to Mecklenburg.
Okay. And so if there's more information, I do have a question regarding staffing. So if there's more information to come, I'll hold that.
Yes, we'll get to that, yes.
Okay. So on construction though, and I almost hate to bring this up, but talked about the walls for odor. And then we're going to have obviously HVAC that's going to do its job there. Is there, and I ask a question because I don't know, but is there concern with odor outside the building?
No.
I mean, how is that mitigated?
No, I don't think that's a normal issue with any autopsy center. And even if it was a small concern, we're a very isolated piece of property, in my opinion.
Okay.
So I would say there's no concern about that. And Dr. Burkett.
Chris, are we venting all of that from the top
Yeah.
out? Okay,
Yeah,
so
so
that's where it will all be. It'll be vented out on the top.
Yeah.
All right. Thank you.
Okay. All right. So the next part of the autopsy center discussion is about operations. So Clayton's going to come up and talk about operations.
So yeah, I did want to take this opportunity, since we're talking about the construction, to talk a little bit about where we've been with the facility and where we're going, what the next steps are from an operational perspective. So this shows a little bit of the timeline, kind of where we started. In October of 23 is when we received those appropriations from the state to construct and operate the SPRAC facility. We get $2 million in recurring annual operating funds, and as of right now, those are written into the statute and the law. So we will continue to get those until if they ever take it back. But right now, they are recurring annual operating funds. We also got the $20 million in the non-recurring, and that was to design and construct the facility. That's what Chris was mentioning. In February of 24, we did purchase some land in anticipation of future jail construction. After some advanced site planning was completed, we realized that a portion of that land would be suitable for the SPRAC facility. And in fact, we are trying to seek reimbursement from the state for a portion of that land purchase. And then in May of 24, the board approved a contract with NCDHHS to receive funding through that state-directed grant. That specified essentially that we would serve as a regional autopsy center for the 9-county region. And I'm going to try to remember those. I believe it's Montgomery, Stanley, Rowan, Richmond, Anson, Cabarrus, Gaston, and Union. I'm missing one, I think, and Moore County. It also identified the authorized uses of those funds as well as some performance milestones. Those performance milestones were essentially saying when we would take on each county. And right now we have all but one. Gaston is remaining. So we have taken on 8 counties as of today. And I just want to mention from, we started December 24 on this timeline, but between that time frame, we were working with the Office of the Chief Medical Examiner to understand and plan for what those facility and performance requirements for the SPRAC were going to be. So that included identifying a temporary facility so that we could begin operations, determining the level of the need to respond to mass casualty events, which is something that Chris mentioned, and then identifying any potential alternative facility options. Depending on the budget, we may have at one point looked at purchasing and renovating an existing facility. Obviously, we are building a new one, and so we are within budget for that. But one of the things I want to point out about this slide is that there was a lot of performance standards and monitoring that went into this contract. One of those standards is that we are required to submit all toxicology samples to OCME for testing. I'm going to talk a little bit more about that in a few slides. It also specified what our reimbursement would be for on a per autopsy basis. So in addition to the state-directed grants, we get autopsy fees as well. And Stephanie's going to talk a little bit about that in a minute. December 16th, 24, we opened the SPRAC facility in a temporary area with Atrium Union in their morgue. And also that was at about the same time that we began contracting with Dr. Brevet and his team to provide forensic pathology services so that we could open according to the state's timeline. And I will say that Dr. Brevet has been very influential and vital to the design and construction of this facility. And then we did end up hiring a business manager. That's Stephanie Dudley. You'll hear from her in a few minutes sort of about the operations. She came to us from the Mecklenburg County ME's office. She's got over 10 years of experience managing business operations there. She's responsible for ensuring that proper equipment and supplies are stocked in the temporary facility, and she's going to do that going forward in the new facility, as well as securing contracts for outside services such as transport, odontology, and building the organizational structure and policies and procedures that are going to guide the facility. And then May of 25, the board approved a contract for our design firm and for pre-construction services. I do want to mention that we hired CPL, who's also the designer on the Food Innovation Center, but they have a specific subcontractor, MWL, who specializes in building autopsy centers and forensic laboratories. So they have designed over 70 autopsy facilities, as well as over 100 forensic labs across the US and Canada. So I think we're in very good hands, and I'll talk a little bit more about them in just a few slides as well. So I'm going to invite up Stephanie at this point. She's going to run through sort of an overview of the numbers. You're going to hear a little bit about operations. You're going to hear a little bit about the funding, and then I'm going to jump back in and talk about toxicology.
All right, good afternoon. As Clayton said, I'm Stephanie Dudley. I'm the business manager. And I'm going to hopefully answer some of your morbid curiosity questions about what it is that we do. Just to kind of give you an overview of the actual autopsy process. So a death is reported to local medical examiners that cover each of these counties. They are trained to do external examinations, and in cases that require an autopsy, they will call the SPRAC and report it to our forensic pathologist, who will then either accept a case for autopsy or let them know that they can handle it in their own county. The pathologist will then schedule and perform the autopsy here at Atrium Union. And the decedent is typically released back immediately as soon as the exam is done to go back to their appropriate storage facility. In Union County, that storage facility is Holland Funeral Service, and once the facility is complete, we will handle that aspect of it. The pathologists will submit the toxicology samples to OCME for testing. That's a free service that they provide to all of the counties, in North Carolina. Once the autopsy reports are finalized and the cause and manner of death have been officially confirmed, The pathologist will issue the autopsy reports and update the death certificate if that is needed. At that point, OCME does a final review of these cases, and they are the ones that actually release all of the reports to the people that have requested them. There are some laws surrounding who can and cannot receive those, and so we just are happy to let them take care of that. A little bit more specific about what we have been doing. So 301 total autopsies have been completed as of February the 28th. We have actually finalized 232 of those cases, and national standards state that we will complete 90% of autopsies within 90 days. That means total case sign out, and we are sitting at 98% currently. Our average case completion ranges from about 6 to 7 weeks. And we are operating a little bit differently than some of the other regional RACs, so the regional autopsy centers. We're taking kind of a hybrid approach, and every center typically has kind of their own way of doing their investigations. So we are going to utilize the local medical examiners, which will allow us to greatly pull back on costs. And it's really just a more efficient staffing structure. We don't have to have the space for, 10 to 12 investigators to cover 24/7, 365. All right. So this is a breakdown of our current caseload per county. You can see that Union County and Cabarrus are our busiest counties currently. I don't think that this is going to be indicative of our future case breakdown. We anticipate Gaston County will be our busiest county, followed by Rowan, Cabarrus, and then Union.
Stephanie, if I can ask a question.
Absolutely.
Why is it that we expect Gaston to be our busiest customer right here?
So yeah, just based on the size of the county and historical case data, they used to be, actually they are currently covered by Mecklenburg County, so we were able to get some of those numbers from them.
Okay, thank you.
Mm-hmm. All right, so we receive revenue in kind of 3 different ways. So first is our state-directed grant, which is on a reimbursement process. So Union County expends the funds, and we are reimbursed up to $2 million for our operations. There are very few things that they do not reimburse for, and those were expenses that Union County was already required to incur. The next way that we get paid is for our autopsy fees. So we are paid $2,175 on a monthly basis for each and every autopsy that is performed. An additional $3,625 is going to be paid when the case is completed by the pathologist, and that will either be paid by the county of the decedent's residence or the state, depending on where they were injured and died. So that's a total of $5,800 for each case that is performed, except for deaths that occur in Union County. To date, we have billed $845,350. $569,850 is for autopsy services. So that's just completing or performing the autopsy. And then that $275,500 is for the county exams that we have done for our regional area. So this gives you an idea of funding. So in FY24, or I'm sorry, in FY25, you can see that we're just kind of getting going. There wasn't a whole lot to report. We started taking cases in December of 2024. And you can see in FY26 that we have much more billed revenue. So it may seem a little bit concerning that there is so much billed revenue versus how much we have collected. Some of this is to be expected because those $3,625 payments from the counties are not paid until the exam is complete. There is always going to be a lag in those payments. The second chart here is revenue versus expenses. And again, you can see in FY25, not that much revenue. We just got going. And from what I've been able to see, in the expenses that you see in FY25 were mostly related to things that you were already paying for. And in FY26, we see that huge jump in our revenue versus our expenses. Now, we do anticipate that the revenue will far outweigh the expenses for the time being. I do expect that gap to close as we open the facility and have to start paying, staff and more, materials, that sort of thing. And then the last chart here just shows you our total revenue versus expenses from the inception of the project in December of 24. And that is all I have. Any questions?
I got one.
Yeah.
The relationship between us and Holland Funeral Service, you tell me what service that they're providing and why they were chosen specifically?
I can't speak to why they were chosen specifically. That has been in place for many years before I came. However, the service that they provide for us is basically decedent storage. So occasionally you will have instances where someone passes unexpectedly and their family has no funeral home. The morgue at Atrium Union does not have the space to store multiple bodies like that. So they have contracted with Holland to provide those services.
Clancy, the main reason is space. Not many of the I don't think any of the other funeral homes have the available space that they did. So they were really our only choice in Union County.
Okay, so I'm going to chime in with my question about staff now. And I guess this is probably more so directed to Clayton, but Stephanie, by all means, if you have any information, please chime in. So I guess what I'm trying to say, or what I'm asking is, when this facility is fully staffed, how many full-time associates can we expect to be at this facility to, I guess, get us fully up to speed here?
So what I mentioned earlier was this is a 20-year facility. When we open the facility, we anticipate having a couple of pathologists, a chief investigator, our forensic autopsy techs. We might have 2 or 3 of those. We'll have an admin, and we'll have Stephanie as well. So it'll be still a very small crew that we'll have to open, because again, we're anticipating about 500 to 600 autopsies a year. And again, 2 pathologists is quite capable of handling that workload. We do anticipate, Chris talked about this earlier, we project out, and MWL, our specialist on this, builds these autopsies all the time. And based on our projections and just the growing number of the county overall, we anticipate one day getting to about over 1,000, right? And so at that point, that's about a 20-year out period where we would have 4 pathologists at that point performing autopsies. And again, we have the 4 autopsy stations. We may want to consider adding some investigators at that point. We don't know how the state system is going to change. Right now, we rely on those local MEs to perform those investigations, and we save a lot of money that way. There's no telling what could happen and what could change in the future with how the state allows us to do that. So we did plan some spaces for a few investigators, open spaces for that work to happen. A couple of additional admin may be needed, and perhaps a couple of autopsy techs. But overall, you're looking at a very small, probably, at a 20-year build out, we're looking at about maybe 20, 25 staff. When we first opened, we're looking at maybe 10. So.
So my follow-up question to that is at what point do we project that the $2 million recurring funds from the state, at what point will our expenses that the county has to supply exceed that $2 million from the state?
It's really hard to project that because, again, we're anticipating receiving those. We know that when the way the current law is written is that we get those annually. So the legislature would have to go in and take action to actually remove it. It's not something that automatically expires. So it's a little difficult to project, but what we're trying to do is bill and collect as much as possible on the autopsy fees, so that we can get a better sense when we're fully staffed of what, we can probably better answer your question at that point once we have more information about what we're billing out and collecting when we have the whole 9-county region. And I think we'd be in a better position if there was a shortfall for any reason, what that would be.
Yeah, I just think it's important for us to understand that, if we're getting 20 million for the brick and mortar and we're getting $2 million per year from the state, that was essentially operational. At some point, there comes the potential that the staffing costs, the operational costs may exceed the $2 million and let's just assume that the state keeps that grant funding coming to us till the end of time. But at some point, if we're fully staffed with 20 or so associates there or professionals there, we may exceed the operational cost. And so that gap is something that I would assume that the county would have to come up with.
Yeah, obviously, I think what we would try to structure is agreements with the other 9 counties because it supports all counties, not just Union County. And so obviously we would want to work with those jurisdictions to try and spread that cost among all 9 counties. Again, we don't know when that tipping point is going to happen. Is it 5 years? Is it 15? We don't. But obviously a pathologist isn't the easiest position to fill. And now we're lucky that we're in the Charlotte region where that might be a little easier. You go somewhere else and it's hard to find a pathologist in those areas. So, and again, with something we're aware of, we're going to continue to monitor it. And obviously, we don't want the county to incur any costs if we don't have to, but it may come.
Thank you.
All right, so I'm going to touch a little bit on toxicology. I am obviously not an expert in this. I'm going to go through some of this information, but Dr. Rivette can probably answer some questions if you have anything specific. But I think even he would say there are toxicologists that do this and they specialize in it even more than he does. So there's a lot of samples. It's not just blood and urine is probably what were typical samples that we would use in toxicology. Postmortem toxicology includes blood, vitreous fluids, liver, urine, and other tissues. You have to account for decomposition, bacterial activity, postmortem redistribution. And because of all that, interpretation depends heavily on all of these different things, what the specimen type is, what's the condition, the case history, and it requires expert level forensic interpretation, not just instrumentation, not just raw results. And because of that, and because it requires that, there's an increased risk for misinterpretation if cases are ever challenged in court. So I think there's a lot here, but I think the main takeaway is that this work is complex. It requires a significant level of expertise to test and interpret these samples, and as a result, can be very costly. And as Stephanie pointed out, we submit our samples to the state for testing. It's free to us. There's no cost to the county to submit these samples for testing to receive the results. It is written into our contract, as I stated earlier, that we have to submit them to the state to be analyzed. However, there is a trade-off sometimes for free services. Historically, that turnaround time for getting those results has been 3+ months, and sometimes even double-digit months if you go back several years. And as you can imagine, this timeline is going to have an impact, right, on any court cases that rely on this type of forensic evidence. But our current turnaround time is around 37 days. It's not ideal, but it's much better than it has been in the past. And that number specifically comes from our facility. That's our turnaround time that we've seen. One thing I want to point out is that the Office of the Chief Medical Examiner recently required all medical examiners and pathologists under the North Carolina Medical Examiner System to sign an attestation agreeing to abide by their policies or face revocation of their appointments. Under their policies, toxicology specimens have to be submitted to OCME in Raleigh only. Cannot be submitted, no portion of any sample can be submitted to an outside lab. So as you can see, if we try to do anything else than submit our samples to the state, there could be complications from that, right? However, there has been a lot of local interest in the toxicology lab being at the SPRAC facility. We know there's some interest at the state level for a toxicology lab to be built on this site. So what we did was we are initiating a feasibility study with our consultants, our designer, MWL, to identify and compare options for operating and managing toxicology analysis through the SPRAC facility. And those options would be, we have an area where we could expand the facility to accommodate a lab, so we could expand that facility. We could hire staff to operate it. We could purchase the equipment and run it ourselves. We could also expand the facility, but contract with a third party or any other party to operate the toxicology lab for us, and they would incur those expenses. Or we could outsource all toxicology analysis to a third party. So all of these are options that we're reviewing. Obviously, we're not doing anything different. We are continuing to send these samples to the state because we are required to do so. But we are looking into this, and we look forward to sharing some information once we wrap this study up. Hopefully, we're looking towards the end of the month or early April to be able to share some of this information with you. Any questions about toxicology? So what are the next steps? I mentioned this earlier. We're going to assume autopsies for Gaston County on June 30th. We anticipate they're going to add about 130 autopsies to us annually, which would bring our total annual autopsies performed to around 525. Because we need to kind of ramp up and we know this is coming, we want to go ahead and hire some staff. Again, this is all reimbursable through the state-directed grant currently. And so we will be hiring a forensic autopsy tech as well as a chief investigator to oversee the local MEs that we see so that our pathologist, Dr. Brevet, can focus on just autopsies, because that is the main thing we want to have him focus on and be able to do. So you'll see this request come through for the FY27 budget. But again, we're anticipating those to be reimbursable through the state.
Clayton, I just want to clarify, and I apologize if this has already been answered and I just didn't catch it. When all of these positions and the current positions, are they considered state employees or local employees?
They're county employees.
County employees. So does the state reimburse their salaries or benefits, or how does that work?
Currently they are. So Stephanie is a county employee right now. Her salary and benefits are reimbursed through the state. Correct.
Okay.
And we anticipate that's how it will continue. Those funds are reimbursable, so we have to submit reports showing we paid them, and then they turn around and reimburse them. Unless the state changes the current statutes, and it's written into the statutes, we anticipate we'll continue to collect those funds.
And on that note, are the autopsy fees, is that dictated by the state? So is it capped out? Okay.
There's standards for both what those fees what you can charge.
So the county has no discretion over how much we could charge for those services?
No, in our agreement, it is written that we will use the state formula for how we do. It's a fixed fee autopsy basis, and that's written into the statutes, and we agreed to abide by that through our contract with the state.
So we're really at the state's mercy for a lot of things here.
We are.
We are.
Again, it is it is essentially a state service that we are the pass-through for.
Thank you.
Thank you.
We're probably gonna go to the jail reuse discussion. That's the meat of the afternoon. I don't know if you want to take 5 minutes to use the bathroom before we get into it, but it's probably gonna be 45 minutes to an hour long. We're gonna take a quick break.
Yeah, I think that would probably be best if that's what works out. Yeah.
One function break.
We're going backwards, I think.
Yeah, we went backwards.
And this, we talked about it a little bit. We have 2 small things after this, but I think this is going to be it. We will get you the information on the solid waste top center and the water out center, either in our regular capital update for the board, the department budget, or it's in your packet. So this is the only thing standing between you all and freedom.
Or we'll call Dr. Prevent back and you can take a long-term nap.
You know, the vice chair had mentioned getting some photos of some of the things we were talking
No,
about.
I did not. I sincerely did not.
All right, so Chris, thank you for the presentation.
Yeah, I do want to say something about SPRAC. The leadership team did a great job getting Prevette and Stephanie on board. There's no way this project would be even close to being successful without them on board. They've done a great job in giving direction, even though we've got MWL, who is a renowned autopsy center designer. They have been instrumental in making this thing successful. So good job on the executive team. All right, so the jail was originally first on the list. So I'm going to go through the old timeline. You know, you've seen this before. Just to mention that, okay, so the existing jail opened in '94, and all the way back to 2004, there's been discussions back in, you know, trying to figure out what the best approach was to a jail expansion. So all the way back to 2004 is when we started seeing the requests. I'm going to skip all the way to the end of the timeline. And so the last action that we had was in the August 11 board meeting, where the board approved moving forward with the adaptive reuse study. And so today we're here to get that for our consultant team to give you the results of that study. And so I'm going to turn it over to Thomas Carlson Reddig, who is with Little Diversified Architecture, who's the firm we've chosen to do the design, and they've done probably 2 studies so far on this jail. And after they wrap up, then Beverly's going to show some updated bond calculations based on some of these options that you'll see throughout this study. So I'm going to turn it over to, well, I call him TCR. I think everybody calls him TCR.
Call me TCR. Yeah. Yeah, good to be here again. Nice to see you. Thank you for hiring us to help you with this. I know it's been on your mind for a long time. So we're going to walk you through it. I do have some colleagues here that I might be calling on if there are some really hard questions. Kelly Gordon with Little, Frank with Hemphill Randall, Frank Randall, and then Alan Richardson, who you probably remember, who helped with the planning and programming. So without further ado, just hit the middle button, goes forward, right? All right, so this is you all know why we're here, what the purpose was behind it. You know, originally we had all sorts of ideas of what to do with the existing jail and the old sheriff's building, but we were able to narrow that down just to things that made a little bit more sense based on feedback from you all. So there are 4 options that we're going to discuss today. The first one, and I'm going to spend a little bit of time on this just so it's real clear. The first one is the intent is to use the existing jail for 100 beds and build new 400, but within the new, the core is still 600, right? So that's the charge is 500 beds total, 600 core. The second one looks at building a new 500 bed jail, 600 core, but still leaving the old sheriff's building in the jail for overflow. Now, when that overflow would be needed is uncertain, right? So it could be immediate, it could be down the road. So that's number 2. Number 3 says, let's build a 500 bed, 600 core jail, but still use the existing old sheriff's building for some of the functions that are in there, or additional functions. The jail could be demoed. And then the last option is looking at all new, and then you would demo. Okay, so those are the 4 scenarios that we're going to look at.
So can I stop you here real quick?
Yes, sir.
Sorry to interrupt you, but go back to option 3 here. So am I understanding correctly that option 3 would essentially be demolition of the jail portion and keeping some of the administrative?
Yes.
Okay.
Yes, sir.
All right. Thank you.
Yep. Yeah, all of those have different construction costs, and they all have, well, the operations and the staff are slightly different as well. So we're going to go through the construction and the staff, and we also have some site studies. So we're calling these 1, 2, 3, and 4. This is more for me. I'm going to try not to confuse. Site option 1 is not the same as option 1 that I just shared with you. There's different ways you can build on this site. And these site options apply to any of them, okay? So what you see in the color here is new jail. And I don't know if is there a laser pointer on this, Chris? It's on the top, right? Does it work? It doesn't work.
Really work on this.
All right, got it. Yep.
Could you grab the microphone? Yeah.
Oh, sure.
It's wireless. You can take it.
Okay. All right, we're good? Is that, all right. So to the left of the color is the existing jail and the old sheriff's, right? And so that particular scenario works. It can accommodate a new building. It can connect over to the existing jail. But its growth in the future is somewhat limited because to the east of that, you have a stream, right? And as you go north, there's existing buildings. As you go west, you have the buildings that are there. It does take away some of the parking, so there's some costs associated with that. The next scenario says you could build directly north of the old sheriff building. It doesn't take as much of the existing parking that's to the north. You would connect through the old sheriff's building. There would be secure points so that would operate effectively. But that's this particular scenario. Each of these have a little different cost. I probably should have hit on that. On the first one, you see the estimated, whoops, I went the wrong way. Estimated site cost, $8 million. The next one looks at estimated site costs of over $9 million. And then you have the third one is similar to what you just looked at, but it's a skinnier building that doesn't impact the parking that's there now, still connects over to the existing, and that's the most cost-effective of the 3 different site scenarios. So just imagine, this is not designed yet, right? This is just blocks, just to show the size that any of these can work with any of the options, okay? And the pink that you see represents 500 beds. So if you did the 400 like in option 1, it'd be a little bit less than that. This one also, you could grow a little bit easier to the south, but you can't grow to the east. Previous one, you can grow to the east a little bit or the south. And then the first one, as I said, you grow to the north, but it's a little trickier. So those are the 3 site scenarios. I want to go through what you probably want to talk most about is the cost. And each of these, I'm going to go through the construction cost, and then we're going to follow up with operational costs. So you have the general construction costs that you see for option 1. Okay, we're back to option 1, where you're going to do an adaptive reuse. You have the cost to renovate the existing jail and sheriff's building. And then there are some repairs and renovations that you're well aware they're required, that have to be built in, you know, the structural issues with the sheriff's building, the retaining wall, things of that nature. The loading dock has some settlement. All those things have to be factored into the cost. And then the site, as I pointed out earlier, they range anywhere from 6.4 to 9.2, right? So when you tally that up and you build in escalation and soft costs, your total ranges from 178 to 181. That's option 1. Yes, sir. It's the most upfront, it's the most cost effective of all the options that you're going to see today. But we're going to get into some of the other factors that might inform decisions. This is assuming bidding third quarter 2028. Design, I'm sorry, is that right? Yeah. Design time is typically about 14 months for something like this, and construction is, 2.5 years. The next one, option 2, says we're going to build a 500-bed jail, but we want the old jail and the sheriff's building to be there for potential overflow. And as I said earlier, that could happen soon, it might be later, right? The study that Alan did showed that it might be pretty imminent. So what you have to do is you have to put money into renovating that building to a certain extent, right, to make sure that it's ready for potential occupation. So it's more because you're building the 500-bed new jail, and you're renovating those buildings for potential overflow. So you see your bottom line number has jumped significantly. And in fact, this one is the most expensive of the 4 that we're going to go through. Okay?
And can I stop you there? So
Yep.
Obviously, the values that we're seeing,
Yep.
this is just for renovation, like in the case, here where we're talking about the old jail.
Yeah.
This is just for renovation. This is not your power bill. This is not.
Correct. No. Correct.
Yeah, because you have to factor that into the total cost.
Yes.
This is all just what
This
it
is-
takes to just have it built and ready to operate.
This is brick and mortar.
Yeah.
Gotcha. Thank you.
Yep. This does account for, when it says total project cost, the escalation in soft costs, and soft costs, as most of you know, includes architect's fees, geotechnical surveys, furniture, technology, all those other things are built into that. Okay? But it does not include the operations costs that you're going to pay every year, and it does not include your staff costs. Okay, so the next one, if I'm going too fast, you can slow me down or keep asking questions. The next one looks at building new jail, 500 beds, 600 core, continuing to use the old sheriff's building, right? But demoing the old jail. Some of the things that were in the previous study still have to happen because a lot of the issues, structural issues with that old sheriff's building, still need to be taken care of. So that's what some of those numbers are that you see below the line. The total number, I think I'm going to make sure my numbers are aligned with what you have there. Yes, 203 to 206. So it's a little bit less. And I have a summary at the end that shows all of these together. Okay, so the next one is option 4 that says, okay, let's build new. Okay? If you build new, you're not doing all those reparations to the existing building, the structural issues, so that's why you see that adaptive reuse cost at 0, but you got to pay for demo, right? And the demo for both of those, does the demo have to happen immediately? I don't know. That's why we have that option 2 in there, right? So that's that number is between $208 and $211 million. So that covers the construction, kind of what we call hard costs. And I think to your questions, or it's Brian, right? Yeah. Want to get into the staff and operational costs because they're a little different here. So option 1, as I stated, is you're using the old jail, right? And you're using the old sheriff's building and you're building a new building. But the number of staff required to do that is not the same as building all new. You're going to have additional staff. And that is represented by the staff operations you see is $16.6 million. And then you're also operating 2 buildings, right? You're operating the new and you're operating the existing. So your operational cost is $18 million. So just hold that thought for a second. I'm going to come back to that in relationship to the next 3. The next one is a little trickier, option 2. So the numbers you see for staff, it's hard to say, right? Because that's the one where we said that's overflow. How much overflow? When is that happening? But just for sake of discussion today, we put the same numbers in, assuming that you're going to have to staff it the same, and you're going to have to keep the building open and operated. Okay? So those numbers for option 1 and 2 are identical. Now you go to option 3, you're still using the sheriff's office, but you're not really hiring additional staff. So your number for staff drops significantly, and then your operations costs are down as well because you're not operating the old jail. You're still operating the sheriff's building, but you're not operating the old jail. And then the last one, you're operating one building, you're not operating or staffing another building. So I said on number 1, I think it's important to note that the delta, this is per year, is $2.6 million for staff and operations, right? So this is an important thing to think about. Whatever you want to do is fine, right? But that needs to be taken into consideration because you take that 2.6 million and you start to build in escalation and increases over a period of time. It's a point of diminishing return because the delta on the construction, is about 30 million. So maybe 10 years, you no longer have the value, right? So that's just something to think about. The other thing to think about is, and we've talked about this before, staffing 2 different locations and trying to work between 2 locations. It can be done. It's done. But it's a little more complicated, right? So that has to be, taken into consideration. You probably want to talk to your folks who are going to be operating a particular facility. Is there anything else on that we talked about? I think that covers it pretty well. So that hits the operations costs, the staffing costs. The document that we sent, the full document, explains how we arrived at staffing. It explains how we arrived at the operations costs. So if you want to dive into that deeper, that's in the document. So, whoops, did I go too far? Whoops. That was the last slide. Okay. So you see your construction costs along the top, you see your staffing, you see operational, gives you 4 different scenarios to assess, determine what the best path forward is. And I'll leave it at that. So in a bridge version.
So, ultimately, obviously, we're not asking you to make any decisions. This is information, but you will have to give us, I believe in April, we're going to need the board to decide, which one of these options, because that's what we ultimately have to put the cost on the ballot. And so we'll need to know what we're going to be asking the voters to vote on. Be aware that, as the gentleman pointed out,
TCR.
Yes, right. There is a long-term cost with operating 2 facilities that really does get you to a point where any savings that you might have generated in the beginning are eroded, and now it actually just costs you more because you're operating it. It's not that it can't be done, it's just as long as everyone understands long-term, if you operate 2 facilities, it's going to cost you more in the long run because operational costs are forever. They don't go away. Also, what's not necessarily talked about is that you don't necessarily have to fully staff it in the beginning. You're going to staff it over time.
Right.
Those are fully staffed numbers. So over time, staff will grow. It may not grow to that within the first 5 years, or it might. We don't know until we have a better idea of how many inmates we have in the facility and what we need as far as that staffing goes. So those numbers are built out, not necessarily what will happen in year 1 or year 5 for that matter. So just be aware, in April, we are going to be asking you guys to pick which one you want and then let us know so we can put it on the ballot. I will tell you that we did meet with the sheriff's office. We talked about the options and some of the information that went in there. Their viewpoint is that they can do it, obviously, but they would prefer not to really operate long-term 2 facilities. They would rather have a facility that is one facility that they operate. They certainly would like to continue to use the administration portion of the building, but not necessarily have 2 jail facilities that they have to operate. Just leave that for you.
Yep.
And that's actually a question that I had. I'm glad that you mentioned that, Brian. So I guess my question is under option 3, that would retain the administrative building there.
Correct.
In front of the current jail facility.
Yep.
So in your conversation and perhaps yours, because I think you mentioned that stakeholders were engaged with this.
Yep.
I guess my question is what does that look like as far as keeping that administrative portion, that administrative building? What kind of an idea do we have about who would be office there? What type of functions would take place there? So that's my first question.
That has not been determined at this point in time. So there's 2 ways, and you can correct me on this, but there's sort of 2 ways to look at it. You can build within the jail, the new jail, all of the functions with training and everything else that would normally be inside of that. And that's actually what number 4 is doing. You're building every bit of all of that inside of the jail. But my guess is that the sheriff is using the administration building for stuff that really doesn't have anything to do with the jail right now. And may want to continue to use some of those pieces in that administration building. So it's really a philosophy of, are we going to build it so that it has all of the necessary components to the jail itself, but the administration building is just used for other sheriff activities? That hasn't been determined at this point.
Yeah, you guys have invested some money into upfitting some of those spaces that have served the sheriff's department well.
Right. So we don't have an answer for you on that.
Yeah.
Question number 2 is, looking at the staffing and operational costs here, these estimates, where does that compare with where we are currently today? Do we have those numbers? And if that's something that has to be supplied later, then that's fine.
It's not in the slide deck, but I think it's
I have a current operation.
And I thought that we had talked about this, when we started looking at the scope of the jail. I just want a reminder. That's all.
Yeah, back in May. Let's see. I'm Yeah, that was exactly. So basically, the total staffing and operational cost for the existing 264 bed facility is $13,120 annually.
Is that staffing and I'm sorry.
Staffing and operational.
So that's both.
That's both.
Okay. So, all right.
So your increase is the delta between 13 and this new number.
Yeah.
That's how much you'll have to increase your investment in operations and staffing.
And those numbers are projected at full capacity though, right? That's
Full capacity
Correct.
numbers.
Yep.
So
Yep.
that would obviously happen over time. But the difference between the 33 million and the 13 is what we look at over a period of time.
Gotcha. Okay.
Okay.
If we were to go with option 2, leaving the current facility in place, does that create, the current facility, does it create any traffic flow issues around the new jail? Anything, will it make operations cumbersome in the new facility?
That was listed as one of the cons, I think, potentially, if you leave it because there's a drive there. But I think, Frank, we've talked about how we could solve that through new routes and drives and things like that to make it secure.
Yeah, you can do a connector over and it's a bit more of a walk in terms of transferring people from booking on over into that older facility. So that can just, impact your staffing costs and
When we met with the sheriff, he talked a little bit about jail code, that this would fall under 2 different jail codes, the old jail code and the new, if there were 2. Are you able to speak to that intelligently at all? Or, and we can reach out to them to get that. I know he said operating 2 facilities, there would be different criteria.
That's an interesting question, right? Because I think you would have to bring the old up to the new standards.
If you're gonna come up to the front.
Yeah, come on up, Frank.
yeah, the goal here would be to try to keep the old jail under the older code. There's been an update to the jail code here fairly recently that in the original code, there wasn't any criteria for exercise, the amount of area that you need for exercise, for example. It just said provide some area for exercise. If you did an extra additional 5 square feet in your day room so a guy could do jumping jacks, you fulfilled that part of the code. But now with the new code, it's 15 square feet per inmate in both the day room area as well as an outdoor exercise area. And that's another difference between the 2 different codes, is that you can decide in the old code, you can do interior exercise, you can do exterior. You don't have to do both. But under the new code, you do have to provide both. So the goal here would be, with your current jail, you do have some outdoor exercise areas. So that's the good news. But we would still want to try to keep you under the old code, because under the new code, the jail has to be fully sprinklered. There is no fire sprinkler system in your existing building now. So if you were to bring that up, that gets to be a little bit of a complicated process, as you might imagine, trying to run sprinkler piping through an existing facility while it's operating.
And I think that's another reason why the sheriff, would take a position that operating 2 facilities, permanently would be more of a challenge. If you see option 2, it uses it as an overflow, and it said we don't know when overflow will take place. You may be able to hopefully keep that under the old jail code for that component versus the new jail following on the new code. Those are all things we'd have to address when we go through design and permitting and how the state would apply that. So again, things that we have to be aware of when we're going through that process.
I didn't want to interrupt the manager, but for purposes of these common area spaces that you, like you said, the 15 square feet per inmate, are these 2 facilities or is it 1 facility?
They'll be attached together. It will still be considered 2 facilities because you're only doing a connector over to to the old facility. So in terms of staffing, realistically, you do have two facilities, and it's going to require some additional staff and command staff to be able to successfully function.
One other question from me, and that is, in addition to the four options that we see here, I guess what I'm asking is there were other options I'm assuming that were considered at some point, and this is what was narrowed down. Were any of those options that were considered outside of the scope of a jail facility or overflow for, say, like other county functions?
No.
No.
The cost of trying to renovate that facility is more excessive compared to what you can use it for. So we basically just scrapped those ideas. It was just not cost effective, unfortunately.
Okay, thank you.
From a designer's perspective on that old facility, they did have it was like 100 or 150 lineal feet of sanitary sewer that was replaced in the existing facility because the sewer had rotted out, and they just replaced what they needed to and what they were able to down one of the corridors, and so it kind of begs the question, what's the remainder of the sanitary sewer like? And I think in our costs, we did include some of the, what the cost would be to replace the entire sanitary sewer. So we're not going to know unless if you run a camera through it. But that's another thing to consider.
And the different options, we got 500 beds, 600 core. And that is expandable by another 100 beds when we get to that place, right? Okay, just want to be sure of that.
That's right. Yeah, and so you should have received the full report. And so this was just highlights of that report. And if you look at some of the layout, and on these options, you'll see that connector. You asked about circulation. You'll see potentially some of those things impacted. So some parking was changed, moved around, and some other things to try to limit the impact to the circulation. Mm-hmm. All right. So any other questions?
No one's brought it up, so I'm going to ask to see if my memory is correct, because I was a little thrown off by these options. It was my understanding that the current jail, the structure and everything was okay at the current jail. It was the admin buildings that had structural issues. So, I've been a little thrown off on 3 out of the 4 options keeping the admin space.
That was, again, our understanding is that the sheriff actually wants to continue to use that space.
Mm-hmm.
So now option 4, it goes away. It goes away.
But I'm talking about the structural issues, because we've been hearing about floodplains and structural damage, and that the structural damage was not at the jail portion, it was at the admin portion.
Chris, do you want to?
Predominantly, that's right.
Okay.
It is at the admin building. I think there's a small section that through this evaluation.
So do you see where my confusion is that we would want to spend $2 million on the admin portion and demolish the jail portion?
It's a decision that you'll have to weigh. The good part of reusing the sheriff's admin building, the repair costs will be much less than the new construction of the space that you're going to be able to remove from the new jail core. So you're basically replacing some of the space in the new core. That's why the construction number is less. The new construction is less. And I guess we can see.
Chris, have you
203 to 214, so it's $11 million difference.
Right, but I'm still, trying to wrap my thoughts around, keeping the portion that we know has structural issues and demolishing the portion that does not have issues.
Chris,
Or-
you've looked at the structural issues, and we've kind of put a plan in place if we needed to repair it, right? Do you want to talk a little bit about like the severity of the structural issues in the admin space?
Yeah, so we did a study with ARP Engineering on that admin portion. Back then, gosh, that was 2019. It was, I think, a $750,000 cost, and now we've got, $2 million. And so the jail structural issues are not as major as the ones in there. And I can't remember, what's the number on the jail structural issue?
Well, we have the loading dock settlement, right, that's 31,000. But you also have that plumbing issue in the existing jail that Frank referenced, that's 1.4.
Which is not a structural issue.
Yes,
Yeah.
It's just an age of piping issue.
And Melissa, I think some of our challenge is if we looked at reusing the jail, it's built in such a way that it just doesn't allow flexibility to do like large open spaces or offices, whereas the admin space that does have more structural issues does. So it's cheaper to fix the structural issues in the part of the building that we can reuse easier than it is to try to reuse the cell block. It's just long term, it's more expensive to try to rehab some of that.
Yeah, ultimately, we're not making a recommendation to
Yeah.
use the
Oh, no, I
admin.
wasn't. Please don't think my question was towards a recommendation. It
Seemed ironic.
It seemed ironic. Thank you so much. It seemed ironic that we were trying to save a portion that has structural issues and talking about demolishing the jail that has little to no issues.
Right. And I think what it boils down to is
Ironic.
what will be the
I don't know if that's right.
what is the use, and what I think we've all come to, at least what we want to communicate is reuse of the jail is more expensive over time. Reuse of the administration portion is less expensive.
Okay.
I think that's what we came to.
Yep, that's a good way to frame it. Yep.
And Chairman Helms, back to your point about we looked at some of that. Are there other county departments that would make sense in there? And when we looked at it, you'd spend so much money trying to make it usable, and then the ongoing cost of maintaining that building for space we may or may not need. It didn't really make sense when we got down and kind of looked at the numbers.
Yeah, listen, I think at the heart of this, this is a building that the taxpayers of Union County have paid for. And, whether that was 30 years ago or whether it's today, I mean, that's something that again, the taxpayers have paid for. And I think that it is incumbent upon this board to try to make the best use of this facility or whatever we can salvage of this facility to get the most value out of their dollars. So, I appreciate, staff looking at this. I'm glad to hear, that we looked at some other things. Thank you for the explanation. But yeah, we're gonna have some tough decisions ahead of us.
Yeah, so any other questions about this? Yeah, go ahead.
Yeah. And we've got tough decisions, and we all have busy lives, and this is coming at us like a freight train, this decision. Does anybody have a real strong opinion of which is the best way to go? Anybody who has really studied this and thought this out,
unfortunately, not my job.
have a strong opinion on which is the best way to go.
Well, you can put me on the carpet here. I mean, strong opinion, no, but honestly, I think you're really between options, really option 2 and 4, honestly. I think those are probably your best bet for that. It's really, ultimately, you're just not trying to fix something that's old and broken and continue to use it. I think it's really more trying to function with a new facility. Some use of the admin building, I think, is certainly reasonable. But I think it would be between 2 and 4 if you would ask me to give you a recommendation. Obviously, you guys got to feel comfortable about it. And you feel comfortable with it.
I think the jail code issue was a very good issue to address today, and the sprinkler systems. I think that was a very good thing to make us aware of.
Yeah, and if I can just chime, I mean, obviously the sprinkler system sounds like it's something that's easy. However, when you well, I guess what I'm trying to say, if this was just a regular old office building, okay, then that would be a very simplistic task. But it's not simple when it comes to a jail, all right, because anything that can be accessible by the inmates can certainly be tampered with, or, you know, God forbid, turned into weapons or whatnot, or dismantled, or, you know, cause some kind of disruption. And so, you know, anything dealing with that is not an easy consideration, nor is it an easy task. So I agree with Commissioner Merrill. I think it's good information to have. But I mean, I guess that just, you know, accentuates what we're dealing with.
Yeah, absolutely. And the challenges associated with trying to put that sprinkler system into a currently operating jail. Yeah. Where your normal sprinkler cost would be like this, trying to do it inside of an existing jail, it's got to remain operating. It's an order of magnitude more.
Would it be possible to maybe get some additional information, like under the premise of option 2, you know, where I think it's option, okay, where we kept that as overflow, okay? Option 2.
Yeah.
Sorry, it's been a long day. All right, so but under the premise of option 2, would it be possible perhaps to get some additional information for the board to consider regarding what it would take to keep that as available overflow space, whether or not it would have to be brought up to the current code requirements? Because I think there's a little bit of, you know, uncertainty there. Mm-hmm. So I'd like to get some certainty as to whether or not that would be considered under, you know, a different type of code regulation, or whether it would have to be brought up to the current standards.
I can tell you this, that as long as there are inmates housed in your jail, typically you've not had to bring the jail up to the current code. But the moment you move the last inmate out for convenience or whatever, when you move the last inmate out to be able to reopen that facility, you're going to have to bring the whole facility up to the current code. So you'll have to keep some inmates in there while you do the whatever renovation.
I think we can do some research and get you that.
We'll get you the final answer, but it sounds to me like the answer might be that you always have to have inmates in there. That it really is an overflow at that point in time. It's really, you know,
Something that's in use. Yeah.
But we'll certainly get you a clarification on that.
Okay. Thank you.
Okay, so not to compound your decision-making process, so Beverly will be next to talk about the new bond numbers. So.
Thank you very much, guys. Thank you.
All right. So, not to make you feel like there's a freight train coming, but this is our bond referendum process. But the whistle is blowing. And if you recall back at your August meeting where you asked for the reuse study, you also gave staff direction to move forward for a jail to go on a bond referendum. So that process is coming quickly now. So at your August 13th meeting, as Brian has alluded to previously, we are asking our education partners to come to that meeting and present their bond request as well. At that meeting, it sounds like you're going to want some follow-up information for the jail reuse and what decisions you make for that to give staff direction on how do we move forward for our bond referendum request at that time. Following that, the latest that we can get direction from you as a board to meet all of the deadlines, to meet the Board of Elections deadline of July 31st is May the 4th. Following the May 4th meeting, we will start to bring back to you all the resolutions that would be required for a bond referendum, starting at your May 18th meeting. And then in June, we would need to introduce the final bond orders to you adopt additional resolutions, and then set the public hearing that is required to be held. The public hearing would be held at the July 20th meeting at the very latest, because we have to get the documents delivered to the Board of Elections by the clerk by July 31st. And then, of course, following that, the bond referendum would actually be held on the November ballot on November the 3rd. Are there any questions about the actual bond referendum process before we move forward? So for the 4 options that you have seen today, I worked with our financial advisor to put together what does this look like from a tax rate impact. And if you recall, the state legislation changed a couple of years ago that requires us to show our voters the highest rate of general obligation bond debt interest rate that's been issued in the past 20 years. So this is why we show you 2 different rates. We show you the legislative required rate, which actually goes on the bond ballot for the voters to see. And then we show you our planning rate, which is a little bit lower because we know in today's markets, we're not actually issuing debt at 5.3%. We're around that 5% range or a little bit lower. So for the first option that you saw today, the financing amount needed, of course, we round these up to the nearest $1 million because we issue bonds in whole dollars, not $40 here or there. Total estimated debt service. This includes your principal and interest for the all-in debt for a 20-year loan. At the 5.34%, you're at around $284 million. From a tax rate perspective, the estimated tax rate increase for that would be 2.83 cents. And we show you an annual increase for each one of these options based on a property value of $400,000 and what that annual increase would equate to. That's $113 additional on the tax bill for that particular property owner. At our 5% planning rate, of course, it's a little bit lower. It's 2.73 cents for an impact to your property owner of around $109. For our second option, which was the 500-bed new jail with reuse of the existing for overflow only, we would need to finance $217 million. Total estimated debt service is around $339 million. With a 3.38 cent impact or $135 to your property owner. For our planning rate, of course, again, it's a little bit less, 3.27 cents or $131. And then for option 3, this was the 500-bed new jail with reuse of the sheriff's office admin building for training and support. We would need to finance $207 million for a total debt service impact of $323 million or 3.22 cents for an annual impact of around $129 to your property owners. At the planning rate, it would be 3.11 cents or $125 annual increase. For the last option 4, which is the 500-bed new jail with no reuse of our existing facilities, is a financing amount of $212 million, total debt service around $331 million, or a 3.30 cent increase, or $132. For our planning rate, of course, again, a little bit cheaper, 3.19 cents, or $128 to your average property homeowner. So, again, not asking you to make any decisions today, but for you to have the impact, so when we come back to you, you can give us some direction on where you would like us to go for this. Do you have any questions about property tax rate impacts, increases?
So, go ahead. Well, I wanted to say what this does not show is the fact that when we start to operate this facility, our budget is going to change significantly. And we don't know what that tax rate is going to be, but it won't be what it is today to be able to operate that facility. So over time, we are going to see a change in our tax rate for operational purposes. Couldn't tell you if that's a penny or 3 pennies or what. Can't tell you what that is at this point in time, but just be aware, this does not reflect those operational additional costs.
Exactly. Yes, sir.
Clear on something there.
Okay.
Let's just take option 4. An estimated property tax rate increase of 3.30 versus 5% planning rate.
Yes.
3.19. Clear that up.
So the state legislature put new laws into place a couple years ago that said if you go to your voters and you ask for a bond referendum request, you're required to show them the worst case scenario. So this is the highest interest rate that's been issued on a general obligation bond in North Carolina in 20 years. So we're required to show worst case scenario to tell your voters it could be this bad, but we know it's not going to be this bad if the market stays the way that it is today. Now, if we see a swing in the market, of course, and rates were to jump up, then it would be higher, but we don't anticipate that happening between now and next year. So, yes.
And just for clarification, it is a 20-year debt that we will be taking on just for the brick and mortar.
Yes, that is
Thank you.
correct. Yes.
Any other questions?
And just to review the timeline, Beverly, so we'll need to give some direction by April 13th. Is that what?
The latest is May the 4th.
May the 4th.
But,
That's correct.
I mean, obviously, the sooner the better. You only have one meeting
In April,
so,
right.
Spring break and all, and I believe that's on the 13th.
13th,
We did
right.
change that. It would have been normally on the 20th and the 6th. We moved it to the middle, which is 13th. So we'd love to have your feedback on the
Right.
13th, but we can wait till the 4th if we have.
Right. And we have to work with our external bond attorneys to get all the resolutions prepared the way they have to be for the local government commission, is why we need a little bit of leadway to finalize those documents and give our county attorney time to review those also.
Thank you.
You're welcome.
I don't always get that, so I say thank you.
Look,
And I don't like to wait till
I'll
the
be
last
honest,
minute.
I'm surprised we don't have an option 5 up there, to sell the old jail. And,
Hey.
Because I'm sure that we'll have buyers lined up. But,
I mean, that's an option.
Stop
All right. Well, thank you, Beverly.
You're welcome.
If there's no other questions, certainly appreciate this information. And, it's not exactly what we want to hear, but I
Don't
guess
kill
it's
the
what we
lady
need
with
to
the
hear.
numbers.
And I think too, to your point, when you were answering Commissioner Balcom's question there, obviously when this appears on the ballot in November, the voters that would be considering this would be privy to these financials.
Correct.
And hopefully they will be informed as to what it is that they're voting on. Because this is a lot of money and this is a big decision for our county.
Absolutely.
Thank you.
Well, I think we have reached, I'm sorry.
Well, with that being said, we've had 2 cycles of school bonds that have gone on the ballot. And Beverly and her team have done a wonderful job not having to raise taxes to worst case scenario when the voters approved 2 rounds of school bonds. And we were able, to kind of flush that out. So I'm not really sure. I'm hoping that voters now are starting to understand when they vote on this stuff, don't be surprised if there has to be a tax increase. So I think it's wonderful that it's put on the ballot, but I'm just not sure that people are reading it because they seem surprised, when it comes time to pay for it. Yeah, to pay. So, but I think because this last state mandated revow has been so shocking, to almost everyone in Union County, I'm hopeful that people will read this a little bit closer when they go into the ballot box.
All right, so
Thank you.
we reached the end of our end of our presentations. There were 2 other items, but in the interest of time, we're just going to send those to you. They were really more just to give you an update
This was the meat of everything here that we wanted to provide you today. If you've got additional questions, please reach out to me or the management team. We will get you that information on the reuse question that you had about whether or not jail standards would have to change or not. But if there's anything else you need from us, please reach out to us. The sun is shining now. It actually looks like a decent day out there. It's cold. It's cold?
Yes.
Okay. But that's all the presentations we have. I can turn it over to you to close the meeting.
Thank you, Mr. Matthews. So I'll just go down the line here. If anybody has any commissioner comments to wrap up the meeting. So, Commissioner Balkin? No? Okay. Well, that makes that makes things easy. I'll just say that I thought that the meeting today was very refreshing, even though we've got some difficult decisions at hand. I had a conversation with our county manager there the other day, and we jokingly said that, well, we don't have problems, we have opportunities, and certainly we have some of those. So, but I will say thank you to staff. I know that you guys put a lot of effort into these retreats. You put a lot of effort into compiling the information for us to review, and when I say staff, I mean everyone. Miss Lynn down there, who is our county's longest tenured associate, and we're certainly very, very proud of her service, as well as to all of our staff that supports us with meals, with snacks, and everything that may go unnoticed that's not on camera. So thank you to all of you. I think that this has been very productive, and well, I guess we'll see how the board goes with these decisions. But again, thank you for all of the effort that you guys put into this. All right. So with that, I'll make a motion to adjourn. All those in favor?
Aye.
All right. Y'all come back some other time.